Okay, let's do this. Oops, forgot I can't switch that. Let me see. There's nothing here that I need to worry about, right? I don't think so. I think everything here looks absolutely perfect. I hope. And if it doesn't, oh well. Did I used to play Super Animal Royale? Yes. Who might you be? Another prospective player looking through an old fossil like me? Did I type this right? I have no idea. Let's see. Let me submit this. How are you doing, Chubbs? I did indeed used to play. I might actually like play more. Maybe. Also, I have to put this up. Also, my audio might just like randomly disconnect because that happens. So also, uh, I did not verify everything, so hopefully some personal identifiable information does not come out. But if it does, that's okay. We will survive. But for now, I'm going to... What am I going to do? Start a lesson, that's right. Antibodies and blood banking. Transfusion reaction. I like this one. No, wait, no, I gotta do what's due. Phase 2. Final phlebotomy exam, huh? Let's see. MLT processing exam. Modern trends in phlebotomy. I think I want to do this one. This is for phlebotomists. It's my homework, yes. Start the course. Okay. Use the table of contents to monitor your progress. Nice. You may continue later where you left off even if you use a different computer. See, this is the important part. Take notes. You can continue from a different computer. You'll be fine. You may encounter practice questions within the course which are not graded or recorded. 1 hour, let's see. Whole bunch of stuff. I'm the intended audience. I need to study for this test. I can describe the advantages and disadvantages of venipuncture and of California specimen collection and evaluate phlebotomy and list safety trends. You got recommended what? Phlebotomy? Produce this for health court, and it's not responsible for any misuse of any devices and procedures inside. Okay. It was hard, so now I look at cardio. Throughout history, humans have used therapeutic bloodletting. Oh God, for religious ceremonies, have had it as a Their base, blood sacrifices, either animal or human, diseases were thought to be caused by evil spirits and demons, and the physician priest, known by many different titles, for example the witch doctor, was called upon to drive out these supernatural causes. Bloodletting was one of the methods used to cleanse a sick person's body of these nebulous impurities. It wasn't until the advantages around the 20th century that bloodletting was expanded to include taking blood for diagnostic purposes. And you have a picture of a vase with the guy's sky getting cut. By the turn of the 20th century, labs were in existence, and the number of analytes found in blood for clinical diagnosis and treatment was expanding. In 1908, Todd and Stanford published the first edition of their book Diagnosis by Laboratory Methods. In addition to procedures for laboratory testing, the manual described general techniques for obtaining blood by venipuncture and skin stick. By the 1920s, the use of venipuncture for diagnostic testing had become widespread, and the term phlebotomy took on a whole new meaning. Take notes, that's important. What else do we got? Let's see. With the spread of HIV and other bloodborne pathogens, the end of the 20th century is marked by increased awareness of city practices for healthcare workers, including those performing blood collection. Many safety devices have been engineered to improve infection control and patient care for better safety. Don't do this. Don't click it on. If you have one of these, you rub it on the table so it goes down. You left homework for the last minute, like a kid doing all this on vacation. I have time. It's not like last minute. I have time. I just don't have a lot. Ungraded practice question. Please select the single best answer in prehistoric time. Modern era. Yes, that is correct. Was evacuated to handler and needle safety device. This really is how it works, by the way. The Needle Stick Safety and Prevention Act was signed into law and forced to change to unsafe activities in blood collection. What? Oh, and forced change to unsafe activities in the blood collection process. Safety includes not only prevention of bloodborne pathogens, but also transmission and prevention of other healthcare transmitted pathogens such as MRSA. Only used once and discarded. Many specifics will be covered later in this course. On November 6, 2000, the Needle Stick Safety and Prevention Act was signed into law. I don't remember. Yes, it was on November 6th, that is true. What's new with tourniquets? This is straight up just like a worse review of the last lesson that I did. That's kind of crazy, actually. Multiple use tourniquets made from rubber tubing. Latex free tourniquets are now used industry-wide. Multicolored tourniquets meant to stand out against the color of the skin of the patient's clothes and prevent them from being left on after the procedure is completed. Pressure cup-like tourniquets are coming in. Their theory is that when this thing exceeds 20 milligrams, there's immediate extravasation of intravascular fluids out of the venous system and into the extravascular tissue. The group has responded to this by developing a device called the VeniCuff, which could replace the tourniquet. It works similarly to the blood pressure cuff, but limits the amount of pressure to 20 milligrams mercury. Always placed halfway between the shoulder and the antecubital line. The cuff portion of the device is disposable. That seems like a big waste of money. Is this actually safe to stream? Well, it involves me drinking water. Hello, Fox. I'm glad you say hi to me here. Why would it not be safe, Softy? You're not going to get a bloodborne pathogen. If you're wearing your proper PPE and maintain scene safety, BSI, I think you'll be fine. What do you mean? I refunded you, Softy. How are you doing, Fox? Vein finders. Vein detection has at times proven a challenge for even some of the most experienced and skilled phlebotomists. If I refunded you, Softy, you were not scammed. You were denied service. That is not a scam. There is a difference. Proven a challenge for even some of the most experienced and skilled phlebotomists. Vein locating devices are not available to improve the chance of finding the vein, reducing their sticks and increasing patient satisfaction. This would be useful. Vein scope. I hope I don't have to learn how all these things work. Is a handheld, no contact vein elimination system. That does something. It detects veins using infrared imaging, uses two safe barcode scanner lasers, an invisible and a visible red. The two lasers work in tandem to provide a real-time image of the subcutaneous vasculature up to 10 millimeters deep. And then this other one does something else. It improves success in difficult sticks on frail, obese, dark-skinned individuals. Alright, this is a good one to know. And other types of difficult access veins for neonates and very young children. Neonatal transeliminator is the solution Venoscope provides. It provides the same powerful LED lights, but it's smaller, more portable, making it even easier to move around neonates and very young children. If they're showing what, Softy? Multiple use donor kits made from rubber tubing represent the current standard. That is false. Don't reuse stuff. How to use blood push machine. My parents won't even have that. Yeah, I know that some people don't have blood pressure machines. It's okay. We all learn. Lab study stream. Yes, we are at war with disease and difficult to diagnose conditions affront her. I am currently being trained on how to kill a lack of knowledge about someone's condition. I will engage ignorance directly and destroy it entirely in defense of knowledge. That's what we're doing here, Runner. We're doing the lab's work. How are you? Evolution of the blood collection needle. The first blood device were syringes with hypodermic needles. The healthcare provider would insert the syringe into the vein and then pull the plunger to fill the syringe with blood. With syringe blood collection was that the vacuum of the syringe was not controlled. Yeah, that sounds awful. That's all with the introduction of the evacuated tube system. This device is not required either the holder or the needle to comply with sanitary needle safety. An example of the needle equipped with this device is shown on this page, right here. Let's do the same by helicopter. Limitation systems and workings. A fronter can answer that question for you. See, him and I are allies in the fight against lack of knowledge, just in different areas. But he has more experience than me. You know, I've used this one before. I've never used this one because anytime you have to use this one, it's usually for a sucky stick. But I've used this one before. The push button winged safety or butterfly collection device is another popular choice for phlebotomists. This device may be chosen for pediatric venipuncture, small delicate veins in adults like geriatrics, or hand veins. The device can be used with a needle holder, an evacuated tube, or a syringe. A needle safety device is incorporated into the design of the wing device to prevent accidental needle stick injury. So that needle safety is this little button right here, this black button. I don't know if you can see it, especially with the chat messages that I saw haven't fixed. But if you see this like black button right here, that's the button you push. The way I was taught is leave the needle in their arm and push this button, and it will jam itself back into the needle. And that makes me really nervous because I feel like you have a needle moving really freaking fast coming out of someone's arm. Seems like a decent way to stab something and cause problems, but it's worked just fine. So that's what I do. Reported less discomfort when the butterfly is used. That many patients even ask for the butterfly when they're getting their blood drawn. Yeah. The butterfly needle is nice, but I don't like it because it's called a butterfly needle, and now it makes me feel like butterflies are gonna bite me. So I have no idea what that means, a runner. This all sounds too confusing, a fronter. I think it's easier to understand where to poke a hole in someone's arm. Vascular access devices. This is probably peripheral. Oh yeah. Pivo is a device for collecting fresh venous samples from a peripheral IV catheter. This needle-free, single-use, sterile device reduces the need for multiple needle sticks, which in turn reduces the chances of patient discomfort, contamination, and bruising, while increasing the chances for high-quality draws. Using existing peripheral intravenous line as a conduit to the vein. Flexible internal blood flow that is advanced to the PIV, around the catheter tip, and the vessel collects a sample. The flow tube reaches deep into the vessel where blood flows more optimal respiration. After it's complete, the internal tube is reacted. The device is easily removed and discarded. In simple terms, it's the max angle you can land the helicopter when landing on a given terrain. I see. What do you mean they call it the nose? What do they call on the nose? Oh yeah, these are tubes. Your blood goes in here. As mentioned previously, the problem with syringe collection is that it is not controlled and consistent. Different individuals will pull the plunger faster or slower, which can create multiple errors in collection. If it's too slow, it would clot, and especially would be useless. If the blood is drawn too fast, there's a chance the blood will hemolyze, that the vein will collapse under the vacuum pressure created by the syringe. The evacuated blood collection tubes solve the problem of uncontrolled and inconsistent vacuum. The original tubes were made from glass, which represent the possibility of breakage and exposing the healthcare provider or a patient to injured bloodborne pathogens. Glass tubes, for the most part, have now been replaced with plastic tubes, which reduce the potential for tube breakage and sufficient spillage, reducing the potential for exposure to bloodborne pathogens. I'm going to let you guys know right now, Phlebotomists drop tubes a lot. I was doing it all the time. Even lab techs drop tubes sometimes. So it's nice to have plastic because this stuff will break. And in class, we had stuff break, and it was not fun. My instructor once dropped the tube, and it broke on his hand somehow. I don't know what happened. I think he went to grab something, and he cut up his hand really bad. We were working in the blood bank with real blood, but luckily there was no blood in that particular tube, so he wasn't exposed. But yeah, that could have been really bad. It's unfortunate too, because that was the Dora the Explorer teacher, so it was both funny and sad that he was the one that got hit. Aren't I really usually really clumsy? What makes you think that? The syringe and needle combination should be the last equipment option that is considered. It is not as safe a choice as the self-contained system because it involves manipulation. But the phlebotomist used to use the syringe to prevent vein collapse. The phlebotomist thinks the vein is too fragile to withstand the pressure exerted by the vacuums of pulse blood collection tube. That sounds like it would be a nightmare to have to do this. What do you mean I dropped myself? Holy moly. Transferring samples to blood culture bottles after syringe collection is always been unsafe practice until the advent of safety transfer devices. They prevent the dangerous transfer procedure, reduce the chance of a needle stick to healthcare worker, limiting integrity. During blood transfer, do not measure and push the plunger, as this may cause hemolysis of the specimen. A grade? What does that mean? Oh my goodness, this stuff just does not end. Radio frequency identification can keep track of specimens to secure the use of RFID labels. These types of labels can be applied to important samples, keep track of them, and let one know if they're removed from the laboratory. Further, because RFID labels can be encrypted and shield the encoded data, labels on samples allow for confidential information to be kept secret from any authorized personnel. Bariatric blood draw. Actually, now that I'm looking at this, the only chairs we had were bariatric. When I took me nap. I wish I did the stream earlier too, but I had issues that I had to work through. I'm honestly feeling kind of lucky that I even am streaming now, because I was about ready to. I don't even remember what I'm saying. But the main reason for the chairs include safety and comfort, as well as accessibility to either arm or patient. Phobia, feel nausea at the sight of blood, may even faint during the procedure. Many chairs are now available. There are bariatric patients. Bariatric chairs for larger patients as well as for young patients being assisted by a parent. Can recline, but assist patients not to faint during vein puncture. A phlebotomist should ask the patient prior to blood collection if they have experienced fainting during the procedure. On a reclining phlebotomy chair. For patients in wheelchairs, there are special armors designed to accommodate blood collection without moving the patient from the wheelchair. Arm stabilization devices. Holy moly. I'm getting sleepy. In order to collect an optimal blood specimen and reduce the chance of patient harm stabilization is crucial during the venipuncture. Venistat Incorporated has produced 2 such devices that promise to deliver both safety and specimen collection success. LabPro, designed to work with most blood drawing chairs. Positions the arm in seconds, does all this stuff. Furry chair. Improved accuracy, improved productivity, improved. Everything is good. second device called Mobile Pro is a variation with added features of portability and attachable to holder. Okay, Mobile Pro is just even better, I guess. Pediatric blood collection and the fear of pain. Capillary collection is preferable on neonates, infants, and children due to their lack of appropriate veins and the reduced blood volume of the patient. Should be avoided due to the risk complications such as clots, infection, damage, basically squeezing, damage, regardless of collection method, needle phobia and fear of pain are real and extremely common in young patients. A routine blood collection encounter can become a traumatic experience for young patients and can mark them for life. Holy moly. Newer blood collection accessories are becoming available and some have already had success. One source accessory is Buzzy, which is an essential non-pharmacological pain enrichment tool for pediatric patients. Of cold and vibration to reduce pain, temperature, and movement. That Buzzy activates the main natural ability to block pain up to 69% of the time in children. It's a crazy device. I need a Buzzy. During blood collection, the device is placed within the blood area, as seen in the upper image, according to Pink Center Labs. The maker of the Buzzy device, studies have actually found improved success using Buzzy rather than previous construction, because the blood flow is going toward Buzzy. I like it. You can use the Buzzy softly. Capillary collection was done primarily on patients with inadequate veins for vein puncture. What do I mean what? I said you can use the Buzzy. What's wrong with the Buzzy? Very young or very old, patients with damaged veins, burn victims, patients with arms and casts, chemotherapy patients, obese patients, and others. With the advent of POX testing and the advances in emergency medicine, capillary blood testing is becoming increasingly common. Different devices than typical vein puncture. Lancets, microcontainers, microhemorrhagic tube, C-lance, and warming devices. For use, these devices are contributed to proper specimens and pre-examination errors, examine some of the innovations in common capillary equipment. And to puncture or cut the skin to obtain capillary blood. I don't really like lancets. They kind of scare me a little bit. They're like bigger mosquitoes. It's not fun. They are specifically designed for finger or heel punctures, which include they have to be safe, which means they have to have retractable blades and needles, and push-button activated safety lancets have reduced the risk of infection, bone injury, and pain effect upon patients. My stream sounded like an ultrasound for a bit. Yeah, that happens. I'm sorry. If it continues to be an issue, please let me know, and I will try to fix it. One of the challenges of capillary collection is the high possibility of specimen contamination. We'll introduce 2 newer capillary collection devices that can eliminate this possibility. The TAP blood collection device. I do not like this. With your BioHealth Incorporated Inc. TAP device with Halo. My brain started ignoring it like ads. So you're just ignoring this educational stream? That's very sad. A stereo. I'm gonna turn this down a little bit because it seems to be a bit too loud on the stream. There we go. That should be better. Now, is this gonna keep working or not? I think it's fine. Thank you for letting me know that this is not working. I need to like make an announcement somehow on like the channel. I don't know how to do that. It's okay. But yes, please keep letting me know if the audio cuts out. Or don't. It doesn't matter either way. With a simple button press, the Tassel On Demand allows patients to collect blood specimens from the comfort and privacy of their homes and then mail them back to the lab. Saves time and money for both the patient and the testing laboratory. Tassel's single-use collection device can collect capillary blood to accommodate a large array of tests with the help of its interchangeable pods, illustrated in the top right. Can I just make a message and pin it? They seem like the same feature. I don't know why both exist. Yeah. But I probably could make a pin. Message will be pinned until the end of stream. Mobile phlebotomy. New ideas about more efficient ways to provide phlebotomy are springing up. With the advent of mobile apps, new entrepreneurs are tapping into a previously non-existent field of mobile phlebotomy. The business model is simple but brilliant. Using mobile apps to request a phlebotomist to provide a service in rural areas where distances make it hard for patients to reach a clinic or a drawing station. Another segment of the population in need of mobile phlebotomy services is the elderly. I'm so tired now. Would have to drive themselves to clinic or lab, even if they were old due to vision problems, Parkinson's disease. This would put them and others at risk. The safer option is to make someone else do it. Was to call an ambulance taken to the emergency department for routine blood work. Yeah, that sounds awful. It's like when people go for like G-tube replacements. That sucks. Or if they have like a blood pressure check they have to do. That also sucks. Silly things. Mobile services can easily reach out to patients in need and provide an alternative to costly trips. Even in scheduling a blood draw from the comfort of your home provides a convenience not traveling, as well as a much safer environment with minimal human interaction and a reduced chance of spreading any infections like influenza or COVID. Stuff like GitLabs provide mobile services throughout several states and are quickly spreading around the country like a virus. Contamination has been a major source of waste and unnecessary hospitalization for patients. Even some of the most experienced and competent phlebotomists have had contaminated blood cultures. Contaminated blood cultures ultimately result in unnecessary antibiotic use, increased length of stay in the hospital, and unnecessary laboratory testing for the patient. Hospitals have been tracking blood culture contamination rates for years, as well as ways to reduce episodes of such contaminations. The introduction of new tools, such as, what is that, SteriPath Initial Specimen Diversion Device. Shouldn't that be CIST? It's okay. Is showing promising results in the reduction of blood culture contamination rates in the U.S. ISDD is a device manufactured by Mongolia. The device diverts the first 1.5 to 2 milliliters, usually volume that contains contaminants of blood, to a separate chamber, isolating it from the rest of the specimen. Thus, it automatically opens a new pathway. Can reduce blood culture contamination rates to below 1%, saving the patients in the hospitals and millions of dollars in necessary hospitalization and antibiotic treatment. This really is just basically a review of everything I've gone over so far. Usually success of the blood draw depends on the skill level and experience of the phleb. Manually drawing the specimen, especially if the patient is so-called a hard stick, and land on chip systems. Venipuncture bots entered the market years ago with limited success. First one was made in 2010. It uses medical imaging, computer vision, and machine learning to identify the best targets. Oh boy, machine learning. A newer robot has been developed by Rutgers, capable of collecting blood and testing it all in one. This bot promises to revolutionize the medical laboratory world by providing immediate analysis of blood samples at point-of-care locations, such as clinics, private doctors' offices, and rural environments. Excellent. This robot will take my job, so I don't have to work anymore. The real challenge for venipuncture technology is to convince the general public about the benefits and have them overcome trust issues about technology. Yes, very true. The goal of the research is to improve blood drawing situations and make traumatic phlebotomy less of an issue. Let me see here. A question now. How many? It's like 1.5 to 2, I'm pretty sure. Yeah. Over centuries. What scared you? Did my mic spike or what happened? Over centuries, bloodletting or drawing has been an integral part of healthcare. Bloodletting and drawing are different things, by the way. The Discord noise? Oh, sorry. Diagnosis and treatment are dependent on blood tests, and phlebotomy is a key that often is a big challenge for both the patient and provider. Advances in technology and safety measures have brought many improvements in the field, and ultimately in phlebotomy. This course aims to bring attention to some of the recent advances in phlebotomy without making any endorsements or promoting a particular companies or products over the others. Our goal is to inform and educate health providers involved in the collection. We have no established relationship with any of the companies and products. Oh, okay, this is the end. And then this is for you guys. You can browse it at your leisure if you want to learn a bit about phlebotomy. Someone in California does it. Exam. I don't know the answers though. True or false? The real challenge for venipuncture is to convince the general public about the benefits and have them overcome trust issues. Yes. You're not learning yet? It's okay. It's available for you to read at your leisure. It's okay. This is crazy. I started doing my homework and I'm already like about to fall asleep. I'm so freaking tired and I'm cold. This does not bring back pleasant memories. Advantages to mobile phlebotomy services include all the following except hard for patients to reach a clinic or drawing station, servicing limited, reducing the need. I'm not reading that when I'm like when I'm leisuring. Yes, it's on all that. Yeah, this is an advantage. Limited mobility patients, this is an advantage. Reaching rural areas, this is an advantage. So this probably isn't an advantage. That is true. They can already draw bloods. They don't need it. A mother comes to the outpatient drawing station with her 7-year-old son for blood work requested by the pediatrician. Considering that all the listed blood collection stations are available, which one is the best choice for using this 7-year-old? Special armrest designed to accommodate blood collection from wheelchair patients. I don't think the kid has cancer, so probably not. Any chair will do. Child should be on a hospital bed, a bariatric chair with the assistance of the mother sitting in the lap. Does a 7-year-old count as very young? I don't think so. We're gonna go with this option. Yay, it's right. That's a toddler? Some of those kids have full heads of hair. What do you mean it's a toddler? Capillary punctures require different devices than typical venipuncture equipment. These include the following devices, except not all babies are bald. I'm just saying that seems pretty old. Capillary punctures require different devices than venipuncture equipment. These include the following devices, except lancets, microtainer tubes. I think I remember this. I don't remember reading anything about warming devices, so we're gonna say this. No. It is not necessary for capillary blood collection. Studies have shown that the Stereopath initial specimen device can reduce blood culture contamination rates to why was this wrong? Oh, I wasn't paying attention, that's fine. It can reduce blood contaminations to below 1%. It's not 0 yet. Why did you refuse to take child educations, Bobby? The standard tourniquet in today's blood collection is a single-use, latex-free, colorful tourniquet because we like to have fun. Under the this legislation that changed bloodborne pathogen standards. The bloodborne pathogen standard under the Occupational Safety and Health Act to provide increased protections to workers from exposure to infections is called. It is not HIPAA. It is not CLIA. It is the Needle Stick Safety and Prevention Act. Why do they freak you out? What is wrong with the children's? I don't think there's anything wrong with them personally. Uh-oh. More people coming in. 1 second. Your tape? Right there. You see the lamp? Like, it's right there. new headset. This thing will not work ever. Venipuncture is preferable for neonates, infants, and young children. No. Took me a second to get that down. Yay! I don't need see the certificate, I just need to know that I have it. Where? Oh my god, why does it do this? That you won't eat? What is it with you and insulting my headset, Softy? My headset is perfectly fine. Alright, let's go to special topics. How do I start it? Oh, I guess this is one that I've already done? I don't remember that at all. Venipuncture can cause fainting. Just pointing out how you eat it. I'm not eating anything. In fact, we're not allowed to eat. This is an important thing to understand. We're not allowed to eat in the lab. So, no eating, no drinking. You go in there and you are dry and thin because there is no eating, no drinking. You just exist in the lab. That is it. That is all. Venipuncture causes fainting. You're very aware of the lab rules. Are you, Softy? Can you tell me what the lab rules are? If I tested you, would you pass? I need you to write me 3 sentences on what you can and can't do in the lab. If it's so easy for you, you should be able to do this trivially. No learning, I'm on break. Then what are you doing in this stream, Sabi? I know you're learning. You said all when we were looking at Buzzy. Venipuncture sometimes causes fainting. Patients experience weakness, lightheadedness, or loss of consciousness at the time of the procedure. Before the procedure. This is too much text. I don't want to read this. Immediately abort the procedure. Why are you doing that? It's going now? Yes. Impossible for me to stream because this headset is just so bad. I can hear out of it perfectly fine. It's just like for whatever reason the connector just does not want to work. if the wire isn't connected in a certain way, it just doesn't work. What seems annoying, Soppy? 15 to 30 minutes. Okay. If the patient, oh, to deal with, yeah, it's pretty bad. I'd rather like, at least if it didn't even work, I could just type. I mean, I want to talk on this thing. It's just, I don't know why it won't let me. It's okay. If the patient feels dizzy after blood collection, place the patient's head between their knees and apply a cold compress. The phlebotomist should never direct the patient to an alternate location while they're dizzy. The patient will faint while walking and be injured. It's never advisable for the phlebotomist to allow the patient to leave the procedure until they can safely do so. Patients who faint should not operate a vehicle for at least 30 minutes after regaining consciousness. Faints during a blood collection is essential. What do you mean I'm in a yapping mood? I'm learning. A hematoma. It is a collection of blood beneath the skin. It is the most common adverse reaction to vein punctures, and many factors can contribute to the formation of a bruise. What, your mic, like, cutting out? And look, hold it like this. Make it work. I think, is this working? Let me see. There's a certain way. I think if I hold it like this, it will work. So I will just do that. Yeah, okay. I just have to squeeze it a little bit, and it should work. So let me know if this stops working, because if this stops working, don't I have like tape or something? So the problem is the wire is not damaged externally at all. It's all internal damage. Like there isn't even like a slice or a cut or like any sign of wear outside at all. So it's kind of hard to tape that because I'd have to like, it'd probably be better off if I like tried to tie a knot or something. I'm not sure, but I'm not good at tying knots, so but to like hold it in place, I would need like a lot of tape, I think. I don't know if I'm just bad at I don't know if I'm just bad at taping things, but every time I tape wires and try and tape them themselves, it just doesn't work. I'm sorry, Soppy, if runner is not here. He cannot talk to you about air. The appearance of a blue or purple discoloration indicates the presence of a hematoma. The discoloration may occur immediately or sometime after it is completed. A bruise may cause slight discomfort for the patient, but the mere sight may generate anxiety and discontent for some patients. A patient may associate a bruise with a negative vein puncture experience, be hesitant to have blood tests in the future. He's good because that's his job. What is his job title? I don't think wire taper would be the name of the job. The phlebotomist should perform a vein puncture at the site of a recent bruise, as this may cause discomfort for the patient and affect the quality of the blood sample. Yes, if someone's vein has exploded, please do not stab it again. Don't try to pop the blood balloon. It's not great. His title is Dad. What's his work title? Not his, I don't even know what you'd call that. His challenge title. A hematoma may also form after having a puncture if a patient has a medical condition that impairs clot formation. For example, a patient on anticoagulant therapy will experience a delay in clot formation. If the phleb is aware of this condition, they can reduce the incidence of hematoma by applying pressure to the site for extended periods. Also, it is best to inform the patient that bruising is likely. Communication is essential to relieve patient anxiety if a hematoma appears. He's an electrician. Yeah, they do put wires a lot. Clean up your act. During blood collection, bacteria on the skin surface may adhere to the outside of the needle as it enters the vein. This can allow bacteria to infect the puncture site, resulting in severe blood infection or tissue. To avoid an infection, the phlebotomists use a technique that thoroughly cleanses the skin of the site before vein puncture. Once the phlebotomist locates a suitable vein puncture site, the puncture vein site is cleansed. This used to make me scared, like the idea of like, I don't know, just forgetting to clean someone. I still am scared of it actually. That I'm gonna forget to rub someone with alcohol, and then I'm going to kill them by injecting all of their skin bacteria into their arm. Like a mosquito. It sucks. The Clinical Lab and Standards Institute no longer recommends using a circular target motion method for arm cleansing. They suggest back and forth friction is superior to circular concentric cleansing. CLSI standards recommended cleansing the site with friction using a gauze pad with 70% alcohol or a commercially prepared pad. The alcohol must be allowed to air dry for approximately 1 minute before venipuncture properly disinfect the site, prevent hemolysis of the specimen, and avoid discomfort of the patient. During the remainder of the procedure, anything must not touch the site. The phleb should avoid retouching the site or cleansing it. If repalpating is essential, the phleb must change gloves and re-clean the puncture site. Cleaning the glove to palpate the site deviates from the CLSI standard. Make sure no other equipment touches the site, including the ends of the tourniquet and gauze. If you suspect your needle touched the site before entry, dispose of it, re-clean it, and repeat the procedure using a new needle. What do you mean, re-clean it? You're not going to re-clean a needle. If you dispose of it, you don't re-clean it. Oh, wait, they mean dispose of the needle, re-clean the site, and then repeat the procedure using a new needle. Okay. Experiences any redness or pain at the site, even hours or days, refer to the physician for evaluation because they are infected. That's why they do that? What do you mean I'd be a mosquito? Why would I be a mosquito, Softy? And yes, that is why they do that. We don't just rub your arm because it feels good. We do it so that you don't die. An 18-year-old male has come to the clinic, come to the outpatient clinic for blood work. What do you mean, man, Sobby? Who is man? His skin pallor indicates that he has not felt well for several days. He also mentions being weak and tired. If you were the phlebotomist, what would you do? Consider how you would handle this or a similar situation before reading the suggested solution on the following page. What would you do, Softy? Tell me. If you were the phlebotomist, what are your options here? This question goes for all of you. Yes. What is it, Softy? You need to decide. This man's skin pallor is indicating he's not well. I wasn't paying attention. The incident command system. Yes. This is exactly what the answer will be on the next page. It will be in big, bold letters. I'm ready. Suggested plan of action. Observe in listening to the patient and assessing the situation. Real ones, no. I wish I had that stream saved. It was fun. I probably have to re-up on that training too, so that stream may occur. Welcome in, Mikes. Are you here to evaluate the? Are you here to learn about the practicality of drawing blood? We draw it and put it in little tubes. We're like big mosquitoes, or sometimes vampires if you draw a lot of blood. I had someone take a lot of my blood once. They told me not to do exercise because you'll get hurt, and I thought it might be fun to try and do a bunch of exercise and see if I get hurt. I didn't, but I tried. So I guess next time I'll try harder and see what happens. It's essential to avoid a potential adverse event. In this case, because the patient is in a weakened condition, it would be best to have him lie down for venipuncture as a safety precaution. Alright, so if you see him, lie him down, put a blanket on, observe for shock, and go code 3. It's just like in school. I learned exactly the situation. If they're not feeling well, they're feeling faint, lie them down, put a blanket on to treat for shock, and then transport code 3. What do you mean, why would I do that, Softy? That's literally the answer. We also have a bottle of orange juice. Screening for diabetes, meticulitis, and geriatric gestational diabetes. The situation is to refer to the incident command system. Oh god, my cable. Yes, they told you no exercise and you did it anyways. I lived. Oh my god, my knee hurts. Confirm glucose tolerance tests help diagnose diabetes. You are very right, Mikes, by the way. I'm just putting that out there. Me from what, like a year and a half ago, I think, would be proud. They took my knee. Yes, they took my knee juice. In case you are unaware, that is a thing, Softy. You have knee juice. And other juice too. And we will take it. So be careful. You don't have a lot. Glucose tolerance helps with diabetes. The procedure consists of these steps. Confirm the patient has been fasting. I know my dad got that surgery. They took it, yes. The knee juice is an interesting one. It's a weird color. It looks like plasma. Collect a fasting blood glucose specimen. Have a patient drink the glucose solution required for the procedure and collect the blood at standard time intervals. I'll keep my knee juice, thank you very much. Well, that's what I'm telling you, Mikes. You should. That stuff is worth a premium, so don't give it up easy. And he did the same thing you did. They told him no moving, and he was schmoving with his crutches. Yes, this is... I mean, you gotta do what you gotta do, Softy, I'm sorry. Blood is then checked for glucose levels. The patient should be instructed to remain in the facility and remain seated between blood collections. The phlebotomist should check on the patient periodically between blood collections, especially during the first hour. For some patients, the glucose solution may cause nausea and vomiting, and the test may need to be terminated. Yes, so what we will do is we will give you a big bottle of sugar, and then we will extract that from your body every hour until we took all the sugar back. This is what happens if you don't pay for stuff. Yeah, Mikes? What's that supposed to mean? Fear is my motivator, so I listen? I did listen, okay? Like, I left my bandage on for 4 hours. They told me that when I take my bandage off, I should stop bleeding. I still had a freaking hole in my arm. It made a little blood puff on my spot. where I got my blood drawn, and whenever I moved around, that freaking hurt. It felt like someone was sticking a giant needle, like they were like stabbing me in my elbow as I was moving. That hurt. I didn't have any gauze, so I ended up having to take paper like toilet paper. No, no, no. I found some paper towels actually. I took one and folded it and had to use a bandage that I had found to wrap it. I'm glad that I had one, else that I held it just to like stop it, and I had to wrap it tight too because that was hurting. So why did they use such a big needle? Because I was not dealing with a mosquito needle. I was dealing with something much bigger. They had. Did you? No, I did the opposite. I made them very happy. It's just funny. People. Why is that funny to you, Mikes? I don't think that's the kind of thing that should be funny. You're laughing at people's tragedies. Anyhow, standard and postprandial glucose tolerance testing, screening for and diagnosis of diabetes, and require a patient to drink a specified dose of glucose in water, 50 grams by 70 grams or 100 grams, or eat a prescribed meal depending on the given test. It is critical to the accurate interpretation of the test results that the correct procedure is performed. If you are responsible for administering the glucose dose and/or collecting the blood specimens, make sure that you follow the procedural steps as required by your laboratory's specimen collection manual, including verification of proper patient preparation, whether they had food or drink, administration of the correct correct dose, and collection of the specimens at the correct time regarding glucose mineration and meal consumption. There's some dark humor in it, yes. Did you exercise the incident command system? I love it, Mikes. You're bringing back very wonderful memories. See, I do this kind of work here, and I'm falling asleep. I'm tired. I've never been more engaged as when I was learning about the incident command system and the National Incident Management System. I was learning about how modular it was and my role as a commander at all levels. I was thoroughly engaged. He can be full of whimsy at people's misery. It's a karma thing. Someone was told not to do something, and they do it anyways and get hurt. Should have just listened the first time. But why are you laughing at people, Mikes? That's so mean. People are just trying to do their thing. No one's being evil. What do you mean I don't listen? I did listen because I didn't get hurt. But I can find some humor in it. You're evil, Mikes. That must be the case. Well, that's a biased response, Sabi. He gave you a recommendation for his books. Hello, Moising. Some people just like to test their limits, heedless of warnings. Well, sometimes that's important for discovery, Mikes, and limit breaking. How is it going, Moising? About 2 to 10% of pregnant women will develop gestational diabetes. Since women with gestational diabetes have a higher risk of miscarriage, premature births, and birth defects, diagnosis and treatment of gestational diabetes are essential. The International Association of Diabetes and Pregnancy Study Groups, the ADPISC, recommends that all women be scanned for gestational diabes at 24 to 28 weeks gestation using a modified glucose tolerance test. The screening uses the 2-hour oral glucose tolerance test. The fasting blood glucose is collected. The patient then drinks a 75-gram dose of glucose solution. Blood specimens are collected 1 and 2 hours after consumption of the glucose beverage. Be sure to label the tubes as fasting 1 hour and 2 hour. You may also be required to put the exact amount of collection on the tubing label. Oh, you didn't raid me, Moising? It's okay. You didn't have to. Are you ready to learn about the instant command system? Moising, you don't understand though. Like you need to understand. Learning about the instant command system is entirely different from anything else you've done in the past. Like, one of these days we're gonna go back there and I'll recertify and I'll show you like what you're missing. It's truly amazing. Mike's has been here. Like, I haven't heard him say a single bad thing about the instant command system, and there's a reason for it. It's because it's applicable to everything like this case study. I'll show you. A pregnant woman who is 28 weeks gestation has come to the blood collection area for a 2-hour oral glucose tolerance test, which we also know as the OCT, to confirm a diagnosis of gestational diabetes. The procedure requires the collection of a fasting blood sample followed by administering a 75-gram load of glucose, administered in an orange-flavored beverage. Blood specimens will then be collected in 1 or 2 hours. The woman has finished drinking the beverage. While she had difficulty finishing, and you instruct her to sit in the waiting room until you come to collect the 1 hour post-glucose blood sample. After 30 minutes, she comes to tell you that she just vomited. Consider how you would handle this or a similar situation before reading the suggested solution on the following page. Mike's, leave me alone. I was inexperienced. If anything, Mike, you would have. Mike's, I think I handled that situation properly, okay? I went there to go and confront him respectfully, saying that I need to do this work. What am I supposed to do? Just not do the work? I have a job to do, Mike's, and so does he. His job is to get worked on. It was the proper response, I promise you. And yes, Softy, this woman did just come up to me with vomit in her face and just say, I threw up. He worked you pretty well. What do you mean? Alright. Why didn't you fight back? I was treating him. He was a 30-year-old basketball player with lung pain. Oh, what was that? I got a thing. I can't even see what the thing is. Cause my stream is filtered. This should be on top is actually the main issue, I think, actually. Now we can see, but I don't know what it was. You have the hands of a healer, don't you? Put your hands on him. I don't think I want to do that. I'm not gonna just, like, put healing hands on someone. Oh, Super Bears. What brings you here? I have not seen you in forever. It's been so long that I almost didn't even recognize that that is your name. Super Bears. Anyhow, the solution to this is, as you would expect, contact the patient's physician. So we're going to a higher authority that can take command for us of the situation. We're the first on the scene is safe. We just came across a scene of somebody who just vomited. So we activate the modular system. And then we go to someone higher who can command the whole thing while we act as the ground force to help this patient. We make the determination that the test needs to be terminated. It may not be appropriate to continue the test in these circumstances, as the glucose test may not be accurate. The physician will need to make this determination. So we'll be on standby for the next course of action, and the physician will continue to get help and make his decision. Oh, what brings you by, Super Bears? Therapeutic drug monitoring. Oh wow, this actually came from school. helps to ensure that a dosing regimen is appropriate for a given patient. The drug's blood plasma concentration is measured to determine the correct dose that will achieve a therapeutic level without overdosing into a toxic range. When a drug enters the body, it reaches a pink concentration that starts to fall as it is eliminated. The amount of time it takes for a drug's concentration in the body to decrease 50% is called the drug's half-life. The longer a drug's half-life, the slower it is removed from the body. Most drugs are removed from the body in 1 to 3 days, but some drugs with longer half-lives can still be detected in the body after an initial dose. The right figure illustrates a typical concentration pattern for a drug given orally via ingestion. Why did you give her glucose? This is true, Mikes. Was just browsing Twitch and saw your name. Didn't know you streamed. Good to see you around again. Yes, Super Bears, you are just in time for me to not play SAR. It's great. But don't worry. There'll be other times where you'll be able to catch me not playing SAR. I'll do my best to ensure you don't see me playing SAR. But I can't make any guarantees. What's that game? I don't know. Peaks and thoughts. Tros, actually. Sorry. A trough. Whatever that is. Sounds like something Moising would know. Anyway, Super Bears, you've come to the right place if you want to learn about getting your blood drawn and the contraindications and why you shouldn't just down enough sugar to kill a small baby. So if you want to learn about that, you should stay here. And we'll cross-train too. We'll learn about other things. A truck? I don't know. It's a trogue. Anyhow, babies cannot have honey. I'll believe you, Softy. You probably know better than me. As the prescribed drug is used and metabolized by the body, the drug level decreases. The lowest level of the drug in the patient's body is called the drug level. The peak for the drug is when the level of the drug in the patient's body is the highest. Body should be drawn immediately before the next dose to assess concentrations during the trial plays. To assess peak levels, the time for drawing depends on the route of administration. Intravenous IV, 15 to 30 minutes after injection or infusion. Intramuscular's IM is 30 minutes to 1 hour after injection. And oral is 1 hour after the drug is taken, assuming a half-life of over 2 hours. Things farm animals eat from. Shaped like a V. This is a serum drug level panel. Okay, collection and communication. The laboratory plays a vital role in monitoring the level of therapeutic drugs. Communication with clinical personnel is critical. This is an example of the incident command system, by the way. If you guys remember, actually, it's been a long time. I don't know if you remember this, Mikes. The number one issue, the reason why the incident command system was made, was because of communication. In emergency situations, you had people doing freelance work. They weren't working as a team. They were operating among themselves together. And that was the big problem. Number one issue was a lack of communication. That's why we needed the incident command system to fix that problem. So it's really everywhere. See, I bet you guys think that this stuff would not come around again. I don't forget. I forget other stuff, not the instant command system. That thing is perfect. It changed my life. Getting hyped just thinking about it. Of course I remember. How could I not? I'm glad, Mikes. What do you mean nerding? This is important, Softy. You know, if you would actually try to learn, you might learn something important here. Blood specimens are collected at specific intervals to determine the drug's TROG and peak levels. The pharmacist uses these TRO and peaks values to appropriately adjust the drug's dose. The phleb obtains the specimen at the precise time ordered for a specific peak or drug TRO drug levels. With some drugs, altering the draw time by even 15 minutes can hurt adjusting and administering the next drug dose. Let's see. Obtain the specimen at the requested time. If the time is missed, act the clinical staff if the test should be obtained or if another draw time is desired. If the clinical staff still wants the specimen collected, note that the drug was administered and when the specimen was collected. Failure to communicate, again, communication, it's a reoccurring theme, could hurt the patient who may be given too little or too much medication based on an erroneous test result. What do you mean you heard me push up my glasses? I'm very out of depth too. What do you guys mean? I don't want the mosquito. I don't want to be the mosquito. I want to read the heartbeats. I'm gonna need to do a lot of learnings. It's okay, Super Bears. Come here to learn. If things go the way that I want them to, I may start becoming a learning streamer. It will be amazing. True or false? To assess drug concentrations during the TRO phase, blood should be drawn about 1 hour after administering an oral dose of the drug. My head. Is this true or false? Change your category to educational one. But this is the war lab, Mikes. Why do I need apples before every stream? Horse maxing is crazy. Wasn't it over 2 hours that you need to do this? No, it was over an hour, I'm pretty sure. I don't remember. When you become a learning channel? Maybe. Let's see. I don't remember. Hold on. I don't remember. Communication. It has to be done somewhere back here. I forget. 1 hour, assuming a half-life of over 2 hours. That was the answer. So it is true. Oh, it's wrong. Statement is false, but should be drawn immediately before the next dose is given to assess drug concentrations. If the specimen was collected 1 hour after administering your oral medication, the result would most likely reflect the peak level. I see. It's the year of the horse. Oh, is that why they're doing the stupid... There's like a thing... Like the horse racing game, I think. I've been seeing a lot of people post memes about that. I don't know if anyone knows what I'm talking about, but like, I remember seeing something about this from my classes, and that's scary. Why is it scary to you, sobbing? I am not quite a professor, Super Bears. I don't know if I can do that. I have my scruples. What do you mean you have scruples? What's scary about understanding, Savi? You shouldn't be scared of knowledge. You should embrace it. I remember he is a very worldly person. He exposes himself. He's wise and angry. And he had an opportunity to learn the forbidden truths, and he never did. Wait, hold up. What am I missing? I'm getting distracted. There's a lot going on. This is the year. Everything will turn into a horse sooner or later. I don't know about that. I don't think. That will happen. He's too much like a dragon. Blood is usually sterile. Any bacteria in the bloodstream is abnormal. A blood culture is collected to detect the presence of bacteria in the bloodstream. Blood is collected into appropriate media to allow for growth and identification of bacteria or the organisms in the bloodstream. A blood culture usually consists of two bottles: an anaerobic bottle, which requires oxygen to grow, and an anaerobic bottle, which does not require oxygen to grow. In fact, you should not have oxygen in there. It actively should not have oxygen in there to grow. Blood cultures are generally ordered in multiple sets, each drawn from separate sites at different times. An improperly collected blood culture can seriously impact a patient's care and treatment. If bacteria enters the culture vial from sources other than the blood, due to improper accession and collection, a patient may need to be treated for an infection that is not present. On the other hand, some collection areas may cause negative culture results when the patient has bacteria in their blood. False negative could result in a life-threatening error. I don't know what Uzumaki is. Okay, proper collection of a blood culture. The following steps are critical to proper blood collection. Proper collection of blood cultures. Understand, guys, if you're going to learn about anything, learn about this. The blood culture bottles should be examined before use to determine signs of deterioration and damage. Make sure you have good blood culture bottles. The broth in the bottle should be clear. Cloudiness or darkening of the broth are indications of deterioration or contamination. Have good broth. The blood culture's blood label has an expiration date. It cannot be used up to that date. Don't let your broth expire. Using an expired or deteriorated blood culture may affect patient culture results. Think of it like those like ramen styrofoam soup cups. You need to have a good bottle of soup, and you don't want to put other stuff in it, or else you're going to mess with the flavoring and then say it's not good. Don't mess up your soup. Prepare it correctly. And if it's opened, reject. You're allergic to horses? Horse sweat is frothy? What if I have a phobia of blood? Why do you say horses are evil, Softy? You wish you were learning about the incident command system right now. Mikes, have patience. It's all coming together, I promise you. What is wrong with horses? Why do you guys hate horses? Blood collection for culture should be collected by venipuncture where possible. An intravenous catheter or line is associated with increased contamination rate and should not be used to collect unless it's the only option. If one culture is obtained from a line, pairing it with a second culture collected by venipuncture is good practice. Result of a contaminant. Just a more painful process for the patient. People walk with their horses in my neighborhood and I feel primal fear. What are the horses doing to you? What have they done? All I see when I see horses are just big. They're big in the back. That's all I see from horses. Yeah, they're big backs. That's it. The skin contains bacteria that are considered normal skin flora. If the skin is not adequately disinfected before collection for culture, they could be introduced in a specimen contaminant culture. But however, these same organisms can be the actual cause of infection. Only way to differentiate between contaminant and pathogen is decrease the possibility of contaminants entering the collected sample using aseptic collection techniques. That sucks. It's all a gamble. You have to decrease the possibility, decrease the chance. The aseptic technique must be employed in collecting blood culture. Disinfect the top of the culture vials with 70% alcohol and allow them to dry. Palpate the vein and identify the site. Cleanse with 70% alcohol. When it's dry, continue disinfecting the skin around the site by applying the primary disinfectant required by your laboratory's blood culture collection procedure. Tinctures of iodine, chlorhexidine gas, chlorhexidine gluconate, or providone 70% alcohol combino are now considered the most effective antiseptics for blood culture. The primary disinfectant should be allowed to dry or sit for the time required by the laboratory's procedure before proceeding with the venipuncture. This will ensure adequate disinfection. Wear a sterile glove if you need to repalpate the vein after disinfecting the venipuncture site. A false positive blood culture may result from insufficient disinfection of the venipuncture site or from repalpating a vein after disinfection. Don't touch. Also, this is what is it, providone? I believe it is. I believe this is what iodine providone looks like. Is yellow. It leaves a big stain on your arm. So it's fun. If they choose to. Mike's, what is this? This is why their legs are basically fingers. I don't know. You guys are hating on horses a little bit more than I think. And also, Mike's, if anything, I think wolves are scary. Everything you say about wolves are true. Everything you say about horses are true for wolves. Except they only eat meat. Wolves are just big dogs. Okay, well then what's wrong with horses? Werewolves? They don't only eat meat? Why are you hearting the werewolves, Sabi? We don't heart hit werewolves here. Smile is okay. Collect the correct volume of blood. They make a delicious pie to bring to Christmas potluck. I've never had a werewolf do this. I've never had a werewolf. I've never had. But I have collected blood before. Oh, it's an animation. I want to see it. Studies have shown that for adults, the detection of pathogenic organisms in blood is directly related to the volume of blood drawn. A false negative blood culture may occur if an insufficient blood volume is added to the culture bottle. For non-automated blood culture systems, at least 20 milliliters should be collected per culture set for an adult. A set includes 2 vials or tubes. Automated blood culture systems will require less blood, but the volume collected should be at least the recommended minimum. Blood for adult patients usually involve the collection of paired aerobic or anaerobic vials. Do you remember what aerobic and anaerobic means? That's right. Aerobic is requires oxygen to grow, and anaerobic does not require oxygen to grow. Congratulations. Now you met my my teacher in, what was that? He was my blood bank teacher, and he was the best. You DM'd it? Oh, excellent. I'll have to look at this later. Let's see. If the volume is less than the recommended minimum to inoculate both vials, inoculate the aerobic vial first. Urine blood can be added to the aerobic vial. Why is that? Most organisms that cause bacteremia and pathogenic yeast are aerobic and will be recovered from the aerobic vial. 2 separate venipunctures may be performed if 2 culture sets are ordered. Each culture bottle should be labeled with the site of specimen collection. 2 culture sets increase the probability of recovering a pathogenic microorganisms. Collecting from 2 separate venipunctures minimizes the potential for contamination. Hopefully, if one was collected collection, the other be free of contaminants. Sounds good. Alright. Thank you, Sabi, and thanks, Mike and Ike. You were great. Okay, keep culture bottles at room temperature and transport. Mouse bottle. Blood culture bottles should never be refrigerated or frozen once they are inoculated. Refrigeration may kill some microorganisms, and freezing the bottles would kill microorganisms if they were present, allowing the fluid to freeze and the bottles to break. Blood culture bottles should also not be held at room temperature for more than a few hours if the growth is not impeded or delayed. Ideally, they should be placed into an inoculator or automated blood culture system within 2 hours of collection. A false negative blood culture may result from refrigeration of inoculated blood culture bottles or delayed transport to blood cultures to the laboratory. So we have not learned about hematology yet. This is blood culturing, which is different. I'm not fully sure what the differences are, but they are different. But when we do learn about microbiology, you will learn that it does not smell good. I have been in a few microbiology labs. They kind of suck. Use the correct order of draw. When multiple specimens for laboratory tests are collected by a single venipuncture, blood culture containers should be the first filled containers. This will diminish the potential for bacterial fungal contamination of blood culture. The blood collection containers shown in the image are displayed in the correct order of draw. Okay, but the chemical preservatives are different from the organism, though. Like, have you been in a microbiology lab before, Softy? Because it's not that bad, but it's not great. Everything is just so warm. Okay, then you need to... If you want to get a better idea, I told you I know the lab rules. You've been in a biology classroom before? It is warm. It is warm. This is true. I'm not saying it's bad, Softy. I'm just saying that if there's infectious agents in there, it's not great. Like, I had to, when we were in class, I had to work with various different disease-causing agents, and I was sad because none of them were gonorrhea. In the beginning of the class, our instructors were like, "Don't sleep on the table because you guys are getting infected with gonorrhea." And I was like, okay, I get to work with gonorrhea. And then when we got to microbiology 6 months later, they never had us work with gonorrhea. We got to work with Staphylococcus aureus, I think it was. And we got to work with Listeria monocytogenes. And we got to work with Strep A and Strep B. And we got to work with one other thing I can't remember. But no gonorrhea. I've been in a biology classroom before. Having to bring a blanket for a chair once. Your computer labs are pretty cold? Well, I hope you didn't get a computer virus, Mikes. I don't want to get any of those. I don't need any of the nasty bits that computers have on them. I'm not touching their RAM without my BSI on. Empathy class, huh? You need to take a class on empathy? What was that like? Your computers have healthy immune systems? I still wouldn't go around touching their RAM mics. It's just a matter of safety. I want to see this empathy class, Sabi. Your professor was insane? I had a few that were like that. Not while they're on, yeah. Computer scientists are a lot. Is he still, like, hurting? A little bit. That sucks. Okay, practice question. Which of the following blood culture collection techniques could cause a false positive culture result? Cleansing with tincture of iodine. Clean off the top with isopropyl alcohol. Repalpating the vein using a non-sterile glove after infecting the vein site. That's true. Don't retouch. You know, when I'm actually was being taught how to do phlebotomy, my phlebotomists were like constantly like, yeah, you can retouch it. It's fine. Oh, my mic, did it die? Or is it... It's windy? Oh. I don't know how to fix that. But as long as you can hear me, I think it's okay. Anyhow, let me go over that story I was talking about. So, like, we would repalpate the site. And I always felt scared to do it. The connection's secure. This thing is in really bad condition. I don't know how it got that bad because no one should have been using it. But it's in pretty awful condition. So I'm doing the best. Just let me know whenever there's issues. But anyway, yeah, phlebotomists just do what they want. They don't care. We're also not supposed to leave the tourniquet on when we're drawing blood. Like, as soon as you get the needle in, you take the tourniquet out. But they tell me not to take it out until the last vial is being drawn. Like, the way we were taught how to draw blood in school is not at all how you're supposed to draw. It's like almost the opposite. In actuality. I guess it doesn't matter too much because they taught us how to draw blood like twice across 6 months. But it's okay. Special tests may mean special collections. Some laboratory tests are so specialized that they require special collection tubes to prevent erroneous results. Describe some examples of special requirements. Special requirements for laboratory tests. Laboratory testing for heavy metals is a special collection consideration. You have to specially blood collect the container material because it has to be free of heavy metals. Class is different from actual practice. Yes, but it's annoying because our instructors were people that literally came from the job just before getting here. Unless if they were doing some crazy like field work, working on like vehicles or whatever, because, you know, it's dumb. But usually they were like coming straight from the lab. It's like, if you're drawing it this way, why is it you come here and tell us something completely different? You know that's not how that works. Make me drink a lot, huh? Okay. I already have to go to the bathroom. Indeed they did, Softy. Okay. Whew. Oh. spilled it myself. Oh, what do you mean, Sabi? Anyhow, what are our other laboratory tests? Special tissue typing. The sample may need to be collected in a special preservative solution. And then we have special blood cultures. They're specimens that must be collected in bottles containing nutrient media to promote the special growth of bacteria within the special bottle. And you have special genetic studies, which are special tubes that may be needed to preserve DNA and or RNA. So remember, the difference between regular tests and special tests. It's important. The phlebotomist is responsible for being aware of special requirements for specific tests. If the correct collection tube is unknown, the phlebotomist must refer to the specimen collection manual, which is also known as the Standard Operating Procedures Book, or SOP, or ask the appropriate laboratory worker for information. It is also imperative that the phlebotomist obtain and use only the correct equipment and not substitute something close. This could affect test results in the safety of the patient. It's kind of funny. Can you start from the beginning of the course? I was busy thinking. You're not learning, remember, Sophie? Procedure for using a winged blood collection device to collect a specimen for coagulation tests. A light blue top tube, or a blood collection tube containing, and this is important, understand, it is 3.2% sodium citrate. My favorite tube. Light blue, 3.2 sodium citrate. I love this. Light blue tube top. It's a blood tube containing 3.2% sodium citrate. Can you switch to talking about the incident command system? Mike's is feeling homesick right now. Light blue tube top, 3.2% sodium citrate. Not yet, Mike's. I'm sorry. I'm being mandated to do this. Trust me, if I could, I would be on the incident command system, but I'm being forced to do this right now. That will be used for coagulation testing, must be filled to completion. Underfilling changes the ratio of blood to anticoagulant, affecting the accuracy of coagulation tests using the specimen. If the evil butterfly device collects a light blue 3.2% sodium citrate tube top for coagulation studies, a waste tube should be drawn first. The waste tube must also be a light blue 3.2% sodium citrate top tube, or a tube that contains no additives. The waste tube is drawn first to remove the air in the tubing of the wing collection device. Once blood flows through the tubing, the waste tube can be removed and discarded. The waste tube is not to be filled. If the air is not displaced from the tubing into a waste tube, it will be drawn into the tube used for testing and cause a short fill of the tube. Less blood volume in the tube alters the blood to anticoagulant ratio needed for coagulation studies. So, make sure if you're using the evil butterfly on a light blue 3.2% sodium citrate tube top, you use a waste tube first. There are indeed lots of tubes. It's very important. We're almost done. Oh my god. Vascular access device. This is the same acronym for a ventricular assist device as well. This is a bit confusing, but it's okay. Vascular access devices include a variety of infusion catheters and ports. The most common device is inserted in the arm on the hand. Provides circulatory medication. Occasionally blood is drawn from the VAD if puncture is not feasible. However, the potential for hemolysis and contamination with fluids or medications is increased with the VAD. Phlebotomists are not usually authorized to collect specimens unless they've completed thorough and documented training. However, phlebotomists may sometimes assist with a clinical person who has been adequately trained collects blood from the VAD. This is a good example of the instant command system here, by the way. It is about in understanding your position and specializing, because you never know when you're going to be the first on the scene and have to take control. The incident command system. Oh God, I almost here, and that would have been bad. If you are present, ensure the person performing the collection flushes the line correctly, according to facility and manufacturer guidelines, to avoid contamination or dilution. The CLSI recommends this procedure. With the specimens collected for drug, the specimen collected from a catheter lumen not used for infusion of the same drug. Withdraw discard amount equal to 2 times the dead space volume for non-coagulation testing. When drawing coagulation therapy has been infusing, draw 6 times the space volume. As a general guideline, 5 milliliters of blood may be sufficient to discard volume for most central lines. However, some require up to 11 milliliters. When drawing coagulation studies, they know the dead space to ensure study results. If drawing directly to same types to be discarded. Obtain it. There we go. Take the transfer to use to transfer the system into a blood collection tube. A needle must not be used. Flush and wash your hands, and then make a notation in the record that the patient was collected with a VAD. It feels like I have a rocket. Why? My mic died. I think it's better now. Is it working? I think so. Pose the arm or hand opposite of the arm that can for that reason. In that case, a calculated collection would be an option if one is needed. However, it's the clinical charge of the patient's care to turn off the dying. Better now? Are we good? Or no? I did. Am I better now? I have it lying in a specific position, and I'm gonna try not to move, but I am already doing all of this stuff. I've manipulated with it heavily. Yes, 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 yes. That's good. Okay, I'm gonna have a little snack because I want one. So here I go. No, don't fall. Softy, please. Please stop. Um. Why Graham crackers, Mikes? What do you mean I can't say I'm having a snack not say? They're goaded, huh? I remember the very short period of time where boat was the term that people were trying to use. And then the goat won in the end. It's a little sad. What are you eating? Softy, please. I can hear it in your voice. What do you mean you don't sound like that? Oh. Oh, goodness. My back. I just had a little, like... It's like a cake-like thing. It had, like, Oreo-ish type of thing in it. It was, decent. I just told you what I ate. Become and remain a competent professional. Do you understand this, Mikes? Sobbing? Super Bears, if you're still here? You guys really... We all need to take note. This is important. To become and remain a competent professional. It's important at all times. It's a good answer. Mike's is like tuning out like this is an online training, waiting for the important part. It is not the instant command system, Mike. I'm sorry to disappoint, but it is related. It's important to be a competent professional. How are people going to trust you if you don't know what you're doing? I'm going back to sleep. Oh my god. It's okay, Mike. This is the service that I do for you and everyone else. I do this job so that you guys don't have to. I serve every day, working all day and all night, so that we don't have to learn about these boring topics. It's a tough job, but I have chosen to serve my country doing so. It is not the mosquito profession, sobbing. Shush. Wake me up when the instant command system comes back. Thank you for properly abbreviating it too, Mikes. You put the commas and everything. This is what I need. It is not the mosquito profession. I'm not a mosquito. Leave me alone. Just give me your blood. Am I good now? Anyone know? The incident command system deserves proper formatting. It's true, mics. The mic is trying to kill me. It's a fight. It's tough. But is it working now? I'm not a horse. I promise you, I'm not a horse. My year is not the horse year. It is not the chicken year. It is not even the rabbit year. No one ever said to me he's like a rabbit. What about the dog here? Nope, no one has ever said to What do you mean you heard me Winnie before? Many people... You've heard it? No. Why does this keep happening? Being done. I just want the audio to work. If I hold it really tight like this, I may have to do a mid-mic switch. Are we here? Are we still back? Maybe? I think. Is it still working? I'm trying. I think I found a good position. man, I was so close. All right. Uh, where did I put my other headphones? Let me see. Okay. Okay. That was hard. Alright, let's throw these away. Throw it over there. Sit over there. Maybe I can use it later. Um. Okay. Is this thing working? Can I be heard? Welcome back. How do I use this thing? Is it working? Hello? Uh, let's see. Uh, let's see. This is so sad. New Year. Full horses. Mike is allergic to horses. He wants wolves. New Year's resolution: we're gonna get a new headset. I'm sorry, Moising. Let's see. It's working. You're a little quieter now. My ears are safe, so it's okay. What? Okay, what's up? Is this like so this is a lot better than my old one? Is that what I'm hearing? The audio quality, the sound quality is good. So yeah, I know. Why are you gawing at me? And yeah, I know it's not my mouth sobbing. I can't put it there. I tried moving it closer and it doesn't work. It's so freaking stiff. I thought I was gonna break it for a second. Cause like I was trying so like it's one of those ones where like you have to attach the thing and why am I laughing? You're laughing. But anyway. It's one of those like headsets where you have to attach the thing and I couldn't figure out how to attach it. So I was pushing it in really hard and I was scared I'm gonna break it. So I didn't break it and managed to get it working. It's a lot of plugging in and they feel weird on my head, but it works now. I'm sorry I'm laughing. I have to fix. Fixed. Okay. Alright, let me know if there's any issues. Why didn't I push it all the way in? No, I did. I did. But when I was pushing it in, I was pushing it in the wrong way. So, for a second, I thought it was going to break. But then it didn't because I figured out how to push it in the right way. And then I turned it enough to where I can use it. So, now I have it. The mic thing is like really far away. Is this the new or old? This is the... So actually, it's the old headset. Because my old headset was my new one. Because that one was newer than this one. I've had this one for a while. And I never used it. I just now opened the box. But my new one was the one that I was using. That I've been using for a long time. So it has a lot of service. So it's a brand new headset? I guess so. I mean, I've had it for a long time, so it's old, but it's new because it hasn't been used, so... It's complicated. But if you guys say this is better, then I'll believe you. Did you get that for Christmas or New Year's? I just got it. It was just kind of here. I don't remember how it got here. I got it. And then I never used it. I don't remember why. I think I didn't want it at the time. Yeah, it was just there. And then I got the old I got the old new ones. And then those became my main. And then I thought I was going to throw this away, but I decided not to throw it away in case I might use it one day. And then we didn't use it for several years. And now I'm just not using it. It was almost going to be a gift for someone else. And then my headphones broke. And I decided I wanted this for myself. So I got them a different model of my old ones as new to them. And then they have the new ones. Guys, it can't be that bad. I promise you. I promise you, it was not that bad. I've I've listened to some of my old streams. Have you watched any of your recent? Okay, look. In the past, it wasn't that bad. Surely, like years ago, it was good, right? Like you guys were there years ago. It was good. Like I haven't always had a bad mic, right? It hasn't always been bad. Please stop making fun of how I use my mic. Oh my god. All you guys say is you have it in your mouth. That's all you say. That's all you guys say about my audio quality. Is you have it in your mouth. You're shocking me. I can't hear. He's too loud. That's all you do. All the time. Ever. AKA like 2 years ago. I can't believe I've known you for 2 years, Moising. That's crazy. What do you mean? I loved it. Why are you so mean to me? What did I do? God, I can't even freaking read. Distracting me. Whatever. You guys got like the new headset, okay? Don't worry, be happy. You're whinnying? What do you mean I'm whinnying? Individuals who collect blood specimens should be assessed for competence by a qualified mentor before being allowed to perform procedures on patients and periodically after that. It is essential to receive feedback from the instructor or mentor to ensure your phlebotomy techniques are appropriate. Any remedial training needed should be provided by qualified instructors in a controlled environment, preferably a classroom and not in the presence of patients. Training and competency assessment should again occur whenever new equipment is introduced. Training and assessment records should be kept in your employee file. Ask for assistance when unsure about a collection. Be professional at all times. You are an essential part of the healthcare team, which itself is an essential part of the incident command system. We're up here now. This is a very controversial change, I see. Softy misses the old mic. Mike's likes the new mic. We're done. Glucose screening during pregnancy. Exam instructions, okay. Oh, this is a hard assessment. Quality healthcare requires the efforts of many different professionals, which the following be considered professional behavior for a phlebotomist. What's so bad about my mic? It was working. I don't understand. You guys make it sound like it was the worst thing ever. Like it ruined the streams. I don't understand. It was terrible? You didn't tell me that. Routinely collecting additional tubes during a venipuncture in case additional tests are ordered. Don't really think that's what you're supposed to do. Notifying the clinical person in charge of a patient's care if a blood specimen could not be obtained. Showing compassion for the patient while not divulging information is more appropriate for a doctor or nurse to share. Continuing to perform until no matter how many unsuccessful attempts have been made. I feel like this is what you would need to do. That's correct. Compassion is an essential quality for a healthcare worker. It is important, however, remain professional and recognize what you, as a phlebotomist, have the right to discuss with the patient. It usually is the role of the doctor or nurse to order appropriate tests and communicate to the patient the reasons for the tests. The phlebotomist must not continue to attempt when a function is successful. Make 2 attempts and then ask to try. Data specimen notify clinical staff you could not get it. Follow the protocol your facility has established. It is also not best practice to collect more tubes than are needed for the tests ordered. Overcollection could eventually cause anemia. When did I say that? And what was the context? Well, thank you all for helping me as well. Now I have a good mic. Apparently. I didn't think these would be a good headset. I'm so used to like... Oh, wait. I think... You don't even remember if you said you think that my mic was terrible. How can you be sure I said that 3 years ago? Also, I remember, I think I got this headset to replace my old Xbox headsets that were like the one earbud thing with like the ear holder stand on the other ear, so you only could hear out of one side. And it had like a tiny mic, and it connected directly into the Xbox controller. I was using those ones, and I think the Turtle Beach ones would replace that. And then I just never did that, I think. It's telling you eat the mic. What are you woofing for? True or false? When collecting blood from a patient who has a mental or intellectual disability, the phlebotomist should ignore the patient, address only the caregiver who is with the patient, and get the procedure over as soon as possible. When collecting blood from a patient who has a mental or intellectual disability, you should not ignore the caregiver. Or not ignore the patient. That is false. All patients are treated with dignity and respect. If a caregiver is with a mentally disabled patient, the phlebotomist may obtain identification and get advice on how to approach from the caregiver. However, the patient needs to be addressed in a compassionate and respectful manner, as is valid for all patients. Woof. Bark. Why are you guys woofing and barking and arfing? There is no dog. There is no dog. There is no barking. You guys are the ones that are barking. The outpatient clinic is understaffed today, as several phlebs, our registration personnel, have called in sick. So are patients waiting, consequently you feel rushed, as a result you can finish without adequately assessing the vein. The blood stopped flowing after filling the first tube because the vein was not an optimal choice. What should you do at this point? Now read all the specimen that is required. That is the correct response. Yes. Don't just send a tube. I'm impressed he's no stopping and he's consistent. I know. I'm reading just fine. When this happens, explain to the patient that enough blood was not obtained in the second procedure. The patient should not be sent away. Maybe you need to also impose hardship on the patient to make another trip to the facility when it's necessary. Your dog? What dog? I don't know what dog you're hearing. You need to perform venipuncture on a 3-year-old child. Which of the following policies or procedures should be followed when collecting the blood specimen? More than one answer is correct. Please select all the answers. Do not allow the parent to be in the room where the specimen is being obtained. Have a trained staff member hold the arm of the child. Attempt to explain to the child what you will be doing before proceeding. Yes. Do allow a parent to be in the room when the specimen is being obtained. Dogs don't know when to stop, it's true. They will never stop. I like when he howls. I've heard a dog howl before. They do that sometimes. A dog I used to have used to bark all the time. Sometimes he would howl. You're learning Moising? What are you learning Moising? Wait, why is this check marked? This is wrong. Oh wait. What the? Wait. Huh, that's weird. Is like the jingle jingle? You're paying attention? Well, if you're paying attention, then I guess I'm winning. Oh wait. How does this thing work? Hold on. Does this thing... Oh, so this does have a mute function, doesn't it? That's cool. You're learning about what to do with a 3-year-old child? It's very important. Do not, or do allow the parent to be with a 3-year-old child. And grab the kid's arm. Grab it. Grip it. Yes. If you see a 3-year-old child, grip the arm in the presence of the parent. This is the lesson. Yes, reluctantly, Rice, just like this. This should be your reaction when you see a 3-year-old child. You don't want to get beat up? Then you better grab. Grab and draw the blood. But have a parent in the room. What is the correct procedure when using a winged collection device or the butterfly to draw a light blue 3.2 sodium citrate top tube intended for a coagulation test if this is the first tube that will be collected in the draw? I'm not grabbing. What do you mean you're not grabbing? You're grabbing right now. Draw and discard a red top tube that contains an additive for clot innovation before collecting the light blue 3.2 sodium citrate top tube that will be used for coagulation studies. Discard and waste draw and discard a waste light blue 3.2 sodium citrate top tube before the tube that will be used for coagulation studies. Draw only the light blue 3.2% top tube that will be used for coagulation studies, and then perform a second venipuncture for additional tubes. There is no procedure because a wing collection device cannot be used for collecting specimens for coagulation studies. I think we all know the answer, right? It's this one. Butterfly is useful. Red top contains clot activator, so don't use that. What dog sobbing? It's not my dog. Jane, remember this character. A phlebotomist in a large urban hospital, works in the outpatient lavatory. She is ready to serve her next patient. Jane, I told you she'd come up in the story again, calls for the patient by the first name in the waiting area. In the phlebotomy area, Jane asks the patient to state her name and birth date, which is the hospital's policy for outpatients who do not have identification bands. The patient does not understand what Jane is requesting, as the patient only speaks and understands Spanish. Which of the following would be appropriate An appropriate next step. I can't gaslight girl boss you. Where is girl bossing here? Also, cancel the test as they cannot be confirmed. Return to the waiting room and ask if anyone speaks Spanish who can help. This is the real option, by the way. You're supposed to use translation services at the hospital to obtain a qualified translator. But normally what I would do is I would tell Softy to translate for me. And if it was Japanese, I would tell Mike's to do it. Ga. Am I getting paid? You're getting appreciated, sobbing. That made me laugh. I know, you're a laugher. Yes, Moising, I know. It is so shocking. I forget what that reads, Mike's. I knew at one point, but I forgot. It's appropriate to ask non-employees on at least 2 levels. It would be a confidential issue and possibly a violation. Second, the layperson asks may not understand medical terms. If you want to explain inflation. It sounds like EA Sports. It's no. I see. So long for no. Yeah, they don't know how to write small, unfortunately. Writing as complicated as possible is a sport. And they're all very good at it. Alright. Well, we're done with Jane now. You guys can forget Jane. But I'll try not to. Every character is important. But you don't have to remember Jane if you don't want to. It's up to you if she holds a special place in your heart for working with a Spanish-speaking only patient. Who's Jane? Dang, that is so sad, Mike's. We don't. Let's not assume, Sabi. We don't know if this is a miss or if this is a doe. It's just Jane. A pregnant patient whose initial test for GD was elevated has orders for a 2-hour glucose test during a 2 hours test. It consists of 2 blood specimens, a fasting blood glucose, and a specimen collected 2 hours after drinking a 75-gram glucose solution. I don't remember. Help me out here. What was the answer, guys? Do you remember? I'm relying on my fellow phlebotomists here. I'm making an exception for sobbing because he's not learning. He told me this, and then he put his hand up. As soon as I saw the hand, it was over. You're a mortician. That's true. You work without blood. Do I know the answer? I know what my book says, I think. Can you find the right answer for chat? I'm trying to remember. Help me, Moising. I need help. Oh. No one knows. I think it is not true. I think you're supposed to do it 1 hour before. I think that's what it said here. In the book, I remember it being a 2-hour test. But I'm pretty sure here it's false. A 2-hour glucose test consists of 3 blood specimens. A fasting blood glucose is collected. After that, a specified amount of glucose is ingested, then collected for 3 blood specimens at 1 and 2 hours. Graded question. A phlebotomist. No, we do not have his name here. This character is not like Jane. Not my Jane. A phlebotomist at an outpatient drawing station prepares to collect blood from a female patient, whom is not Jane, who is scheduled for surgery the next day. The patient tells the phlebotomist that she is afraid of needles. It's both, so they can cancel each other out. This is true. The phlebotomist assures the patient that everything will be fine and sits the patient in the phlebotomy chair. The phlebotomist talks the patient through the beginning of the venipuncture, and the patient appears to be doing fine. At the second of 4 tubes is being drawn, the patient suddenly blurts out that she feels very dizzy and is going to faint. Please select the single best answer. Finish the venipuncture and hope the patient doesn't faint. Call for help and continue to draw the blood. I like this answer too. Immediately place ammonium salts under the patient's nose. Terminate the venipuncture, call for assistance, now the patient put her head between her knees. These are some good options. The only one I have not seen is the ammonium salts one. Terminate the procedure and place the head between the knees. Ammonium smelly salts are not recommended as they can irritate the patient and cause anaphylactic shock in some people. Seek help from a nurse or physician, but stay with the patient for at least 15 to 30 minutes to ensure the patient is fully recovered from the fainting episode. Make sure substitutes at your facility are followed. Yes. Salting people. Salt is so useful. As a phleb, what should you be aware of regarding the geriatric or elderly patients from whom you'll be collecting blood specimens? All the patients have hearing loss and should be spoken to in a very loud voice. Geriatrics lose muscle tone, causing their veins to be less stable. Thin and paper, a bandage with gentle adhesive is recommended. Treat all elderly patients the same as you treat a child. If another adult accompanies them, only address the companion. As long as you're not a snail. What happens if you put salt in a snail? I mean, if I was, I don't know. This is a weird answer because if I'm doing phlebotomy, I'm wrapping that thing in a tight bandage. Not like super crazy tight, but tight enough to stop the bubble that's going to come on their skin. A little band-aid is not really a lot. Why are you saying they're cute? What is so cute about slugs? Sea slugs. With age, muscle may lose tone and skin may become thin, which requires a phleb to take special precautions during venipuncture. Senior patients deserve respect. Saying very loud shall be done if the patient lets you know they cannot hear you. Oh man, I'm not good at this one. Match the following statements regarding therapeutic drug monitoring with either truck or peak level. Mollusk. The blood sample is collected immediately prior to when the next dose of drug is given. I think that's a trog, right? The point at which the drug is lowest in the patient's body, that's also a trog. The point at which the drug is highest is the peak. The blood sample is collected after a dose of the drug is given at a specified time. That's probably a peak. Wow, I did it. And I didn't even have to cheat. That's crazy. We cannot view the certificate. Skip the survey. We will go back. Oh my god. I have so much of this. Let's see. They just keep giving me more. He just keeps dumping stuff on me. It's annoying. What does this stuff do? I have to go to the bathroom, so I will return momentarily. This and then it's not working. There we go. Can you pet your dog for us while you're out? Contemplating all of his homework. He's drawing the cool ass. Oh my god. There is no dog. I keep telling you. I don't know what dog you're talking about. What the heck? Alright. I will stop gaslighting you. I don't know what else you're talking about. Alright. I'll be back. Oh, this thing is itchy. Oh, okay. I'll be back. phone for a second. You said that before I got back, Sabi. What are you guys talking about noise? What are you guys talking about noise reduction for? You heard me what? Since we can hear your dog. I don't know what you're talking about, Sabi. Heard you opening your door. I did open a door, this is true. I'm not. I literally agreed with you. I'm opening a door. I don't know what else you want to hear. How long have I been streaming? I have been going for almost 3 hours. That's crazy. About what dog? Where are you going on about a dog? I could keep working on this homework, but I kind of don't want to. Why are you bapping? You're like the fighting cat. I don't feel like doing another lesson, because these are really long. Unless if there's like a really short one. Let me see. Let's see how long ABO is, actually. This might be fun. ABO, it's a basic level. Yeah. Oh my god, it's 56 pages. Isn't it due soon? He's got 30 days. The days fly by, it's already 2026. Yes, that's why I'm working on the homework. I have 1 month left, so I do not have a lot of time. I need to finish, or else bad things will happen. We'll see how much of the ABO system I want to get through before I stop, and then maybe I'll save this lesson for later, and we can pick up on it later. I'll think about it. The predictability of ABO antibodies and serum lacking the corresponding antigens makes ABO typing a simple process in most cases. However, the importance of getting it right cannot be stressed enough when a patient will be transfused with blood from a donor. If a patient receives donor cells containing alpha or bravo antigens and the transfused patient's serum contains the corresponding antibody, the donor cells will be destroyed almost immediately, causing a severe hemolytic reaction and sometimes fatal reaction. Therefore, it is essential to understand the ABO blood group system thoroughly. In addition to red cells, ABO energetic determinants, or epitopes, are found in many tissues, body fluids, and other cells, including endothelial cells and platelets. Because ABO antigens are so widely spread, ABO antigens are also a major consideration in solid organ and bone marrow transplants. In 1900, a German scientist, Karl Landsteiner, discovered the blood groups differ from one individual to another. He took blood samples from 5 associates himself, allowed them to clot, and then separated the serum from the cells. Landsteiner found that when he mixed the serum and red cells from different individuals, some samples clumped and some didn't. Our present-day classification of the ABO system is based on Landsteiner's realization that agglutination occurred because of highly reactive antigens present on red blood cells, which corresponded to antibodies present in the serum. Landsteiner isolated and named the red cell antigens A and B, and the corresponding antibodies anti-A and anti-B. If the red cells contained neither antigen, he called these cells O, representing 0 antigens present. The fourth type of red cell, AB, was discovered in 1902 by von de Castillo and Cirilli. Uh-oh. I am getting a phone call. I will be back. Okay, I'm back. It's not just that I don't want to do homework, and I'm not ordering a pizza. Mikes, don't say goodbye forever. I told you not to do this. This is not good bedside manner. You keep telling me I'm gonna get punched in the face, but you don't have any good bedside manner. Bro. Contain both A and B antigens on their surface. Landsteiner realized that natural antibodies develop that are directed against antigens not present on the red cells. Individuals with A antigens on the red cells had sera containing the anti-B antibody. Individuals with B antigens had sera containing anti-A, and O individuals contained anti-A and anti-B. Oh wait, I should get rid of my ping because this thing doesn't matter anymore. Unpin this message. You should. I'm hungry. Man, I was like the horse. I'm not a doctor. This doesn't apply to me. So you can just be an awful person because you're not a doctor? I had no idea. Where has this been all my life? Subsequent researchers determined that AB individuals had sera with no AB antibodies present, and sera from O individuals may also contain a separate antibody, anti-AB. Anti-AB possesses serologic activity not found in mixtures of anti-A and anti-B. Anti-AB sera will agglutinate with AB and AB cells. This is particularly useful in detecting weak A and B antigens. The table on the following pages summarizes the antigens and antibodies for each blood type. Essentially, what this means is the inside of my body is poison to the inside of your body. You don't want those two things to mix. So don't do it. Trust me, it will be the worst mistake of your life. We do not mix. I do not go in you. Table 1, ABO blood group system. This is what you got. Excuse me? What are you confused about? We have A and B right here. If you're A, then you can go with the other A. If you're B, you can go with the other B. If you're not A or B, you can't go with A or B, or AB. And if you're A and B, you can go with A or B or AB. What do you mean I do this all the time, Mike? What was wrong with what I said? Everything that I said makes sense. I just explained it. If you like, I don't know. Oh. What do you mean, Mike? I don't understand. To a saint. What does this mean? I don't know. How much time is left? I'm not going to finish this lesson. This will take too long. In routine practice, specifically prepared blood group containing sera containing anti-A and anti-B, and optionally anti-AB, are used to identify the 4 types of red cells. These sera will agglutinate cells with the corresponding antigen. This is called forward typing. So basically, what they're doing with this is you have manufactured serum that you're putting blood into, and then you see if the serum grabs the blood and turns it into a big, like, it doesn't look good. It's like a bud on your tongue is what they look like. 1v1s? Okay, soon. So if it makes a big bud, then it's going to be a 3 or 4 plus reaction. If it doesn't, then it's 0. No, a bud, like B-U-D. Yeah. I hope you don't have a butt in your tongue. That would not be good. Let's see. Like cleavage? What? I don't. What do you mean? Antibodies occur predictably in sera of all adults with antigens. These antibodies are necessary for definitive identification. The individual serum is therefore tested against reagent cells containing known antigens. This is called reverse typing. So basically, you have to spin down their blood and turn it into serum. Because you make all the blood sink to the bottom and you have serum at the top. And then what you do is you take that, and then you're going to take some cells that you have that are already in a small container. They're like manufactured cells that people have made. And you drop it inside of these the blood tubes, and then when you spin it down, you'll see if it makes a bud or not. Mike's like the instant command system. Why does agglutination sometimes occur when red blood cells from one individual are mixed with serum from another? All right, if you guys get this answer right, I will play SAR. I need you to answer. This is a check on learning. Come on. Someone get it wrong, please. That we shouldn't answer correctly. Mike's, help me out here, please. I know you know the answer. I'll volunteer you. You can be voluntold. I have ringing in my ear. Clumping never occurs. Let's read the options here. Antigens in one person's serum may react with antibodies on the other person's RBCs. Antibodies in one person's serum may react with antigens on the other person's RBCs. The individuals may have different immunologic histories. Clumping never occurs. Why does agglutination sometimes occur when red blood cells from RBCs from one individual are mixed with serum from another? The second one, antibodies in one person's serum react. Tinnitus from the barking dog. It's the second option. It's the antigens. Antibodies. This is making me. Why is it making you Mr. Professor? This is what Mike says. Mike's, you're correct. This is right. Antibodies in one person's serum may indeed react with antigens on the other person's RBCs. I got this wrong on a test once, and it was annoying. It's because I wasn't paying attention to the wording. I selected like antigens because I was thinking like it's just the anti thing is the thing. So I said that it was the antigens and serum may react, but that's not how it works. Antibodies attack the antigens. The antigens are just like the catalyst or activator. I hate test questions that do this. Like we know what we're talking about. This is a stupid question, but it's okay. Alright, Mike's fine. You win. We won't go over Punnett squares. You know what happened? One time in class, we were going over genetics, and we went over Punnett squares. We were going over Punnett squares, I think, until lunch. I think, yeah. We started class at 8. Lunch is 11:30. We usually get released like about 5 minutes before that. We went over Punnett squares until like 11:10. And then we went to lunch, and then we were standing around doing nothing in the heat forever. It was awful. And then we came back, and we confirmed that we understood the Punnett squares. The instructor confirmed with us that we understood. We all had a big class discussion to make sure that we understood how like the little things match up, and you can put them together with your your fingers, and you can get like a certain type of thing at a percentage chance. And then after that, he proceeded to have probably the fastest lesson that we had in the entire program. It's like if Ultra Kill or like similar games like Nuclear Throne, Risk of Rain, Ultra Kill, even Neon White, if these were all games, you could like, if you could feel that kind of energy, that's what that lesson was. It was not my favorite lesson in the program. My favorite lesson was the visual novel between calcium, vitamin D, and one other hormone that I can't remember. But this was this was still a really good lesson. I need to see if I can find my notes so I can remember the story about the vitamin D and calcium visual novel. That's my favorite lesson. It's great. You should have been there. It was on my exam. They moved to them for 5 hours. Alright. That's okay. Were they in love? Yes. It was a love triangle. Hold up. What's the other element? Oops. Hold on. Whoops, that's wrong. What was it? Yes, that's it. Parathyroid hormone and activated vitamin D. This was amazing. So the way that it worked, I'm trying to remember. This was a while ago. So calcium is really important to the body, and parathyroid hormone does not like calcium in the blood, or it does not like calcium in the bones, because when calcium is in the bones, it likes to bind with phosphorus. And calcium likes to keep No, parathyroid hormone, PTH, likes to keep calcium to itself. It's very clingy, very much attracted to calcium. It doesn't like phosphorus. There's actually a little picture here. This might be helpful. This is pretty much... This might be a better one here. This is pretty much how it works. So parathyroid hormone secretes parathyroid hormone because what it does is it tries to extract the calcium from the bone, and in order to do that, it needs to talk to the kidney because it's got to flush the phosphorus and the calcium away. But it's a ploy because the kidney can actually reabsorb nutrients, and it will then get absorbed by vitamin D to be put back in the bones. Oh, I might have to stop the lesson early because they are. I have to attend to something important. We'll resume the lesson later. This is my favorite lesson. But for now, I'll actually, let me see. If it takes a while, I'll come back. If not, I'll just end stream and then we'll play 1v1s off stream. Give me a bit. Okay, I am back. Sorry. I. Yes, thank you, Mike. I am a big back, I know. I'm back. Sorry about. I know the lack of a VRB screen. I am ashamed as well. I just was learning. I did not have time for a BRB screen for reasons that are reasons. And hopefully that will not happen again, but we'll see. Okay, we're gonna play Super Animal. What do you mean, what am I eating? I'm not eating anything. Let's see. Just because there's a wrapper doesn't mean... Switch to Windows. Are you using Linux, Mike? Just because there's a wrapper doesn't mean I'm eating. Being a Linux user must make you feel so powerful. I don't know what benefits it offers, but everyone acts like if you use Linux, you're the king of your own world. What is it? I was chewing. I was not chewing. I am not. Also, I guess we'll play SAR. You feel like Sisyphus? Why? Because you use Linux and it doesn't work and you go back to Windows anyways? What do you mean you heard it? I don't know what you're hearing. You're convinced I'm eating food. You always make that face. 45 seconds and I'm leaving? Hold on, Mikes. You can't leave yet. You have the time off and I need to write a stream title. I'm trying to figure out how to put exercise in here. Because I'll fight you, but every time I lose, I'll exercise. Why? Because I'm on stream and I can't talk, so I need some other way to occupy myself. Also, I need to make sure I'm nice and sore for when I have to do things. At least for now, because I might actually have to go soon. So I shouldn't have to do this for very long. Alright, let me launch SAR. What do you mean I owe you SAR? You don't even want to play SAR. I told you we can play SAR, and you were like, I don't want to play SAR. I want to play Human Vol Flat. Or Zomboid, but you don't want to play that, so no SAR. And then we didn't play SAR. I need to fix this thing with the chat. Can I shrink this down yet? How is this for size? Does this seem good? Or should I have it be bigger? Okay. Mike, I need you to join my party. Also, I don't like this new like invitation system they have. It does not work for me. There's a good chance of that. I have not played SAR uh, with serious skill in a very long time. And I was never good to begin with, so I don't put a lot on me. What do you mean, what am I eating? Why do you do this? All of the time, you ask what I'm eating. Alright, while I'm waiting for mics, I'm gonna start the game. I'm not eating, Softy. I promise you. You're here? Oh yes, Staff Sergeant Opre. How do I invite you? Putting music on. Sobbing is giggling something crazy. It's important for the clips. Mikes, please. You got the candies and everything? What candy? And I'm serious, by the way. What? Why can't I? I can make the sound effect. I can't get in the freaking ball. I could light a candle and grab a blanket. I need to stretch. I can't fire the silent pistol anymore. I'm so slow. My finger gets tired. I wonder why this isn't an emote. It seems like it would be a really good one. Aphorism? That's a new word. I need to learn that. That's me when I'm yelling at you. You need to install the game again. Softy again is laughing. With the big boisterous laugh that he has. This is so funny. Oh wait, I can get Carl coins. That's right. What do you what do you mean, Softy? What are you getting on me for? Oh, this guy. Only one time. At least 3 in a row. This guy understands. Movement is not possible in this game. I understand how he feels. I feel sorry for the thousands of hours he's going to dedicate trying to learn how to move. It's a very familiar story. I sympathize. I don't think I can bear to watch. You sound good. I'll trust you. Hold up, I have to copy this. So go here, go to add a friend. 1573 C416 29A D9E 69. Did it work? I'm glad it worked. It's the 6th documented one. Oh, whoops. I didn't mean to complete that. How do I do this? Wait, I can send you a message? Oh yeah, that's right. You do it that way. How do I invite? Oh wait, it's late. I'll probably play for a little bit and then I should go. I might come back later, but I'm gonna end stream just in case it takes a while. Wait, how do I... Why won't it... Crossplay is how you do it. There we go. At least they finally have this down to a system. Why does this upset you? It's too hard for them to do that. Give us clothes, Sardaz. Mikes, you don't even want to play this game. Are you not cute? I don't remember how any of this works, by the way, Mikes. I don't remember the commands. They don't listen to any of us. Okay, to be fair, Mikes, making a game is hard. Can't I just invite you in and start it like this? Oh my god, you have to matchmake to get into a private lobby? Oh, you're here. That's weird. This sucks. I don't want to be on this Victory Island. Like, why? I can't access the whole rest of the map now? That is true. I will have to go to the SAR wiki, actually, to figure this out. Here they are. I thought I had these stored on a file, but I don't. What I have are old Melee only guides that I never finished. Oh, whoops. Actually, moles I think are fine. I'll turn back on. They reduced the speed of gas, right? So it takes even longer now. It's okay, I'll leave it as is. I never learned how to melee someone because of you, bro. That's not true, Mikes. You know how to melee. You're lying, actually. I thought about finishing them, but it's just like I really don't understand what they were thinking when they did that, and they chose like the last circle for it too. Why would you do that? The last circle is like already takes forever to get in. It's the most boring part of the game, and they made it longer. Why? Who asked for a smaller circle? We'll do a 30-second delay. I haven't meleeed everyone, I think. I've tried, but I don't think I've meleeed everyone. But it's been a long time, so it's hard to remember. I do kind of miss melee runs. I tried it again, like a couple of days ago, and I was bad. I could not do it. Not at all. Wait. What is our eagle path? Oh, that's fine. Okay. Let's go to the labs. He never learned how to shoot pistols? I think you mean me, Mikes. I'm bad without my automatic weapon. I'll probably play. I'll play until I need to go. I hope my controls are still okay. Mike's always taking top labs. This is so sad. I could never be on top. Sure, I'll take a bow. These are a bad idea. Don't say that? What do you mean don't say that? Don't say what? Yay. And I can still attack in Alt F1 mode. Why'd you put him down? I did too. I thought you wanted me to win so I wouldn't have to prove anything. Also, it doesn't have to take this long. This is crazy. They made it take so much longer to get into it. Like, it takes 5 seconds. More like 6. More like 7. It takes like 8 seconds to get into a freaking private game now. Why does it take 8 seconds? It used to take like 3 before. This is true. You can add it to the workout, the warm-up part of the spreadsheet. Does that not work anymore? Oh, there we go. I was doing it wrong. Yeah, let's go to the resort. Playing 1v1s is fun. I like this a lot. Why don't I do this more? I love suffering, huh? Mike's getting straight into it. Alright, let's see. Uh-oh. I have this weapon that I don't really know how to use. I forgot this map you can run out of ammo on. Scary. Ouch. Oh! He had to reload! I live. Oh! I look so baby. Mike's is fast. Alright, I'll do my 10. What the? No, wait. I did not mean to host solo. I forgot that I had to do it like this. Oh, I already did that. Oh, Mike's is still in. Apparently. What exercises am I doing? Why won't it run? Do you have a request, Mike's? What happens if I join? 599.hdl. Will it let me join? That is so weird. Jumping jacks? Okay. Not my favorite, but I'll do it. That actually wouldn't be a bad idea, a persistent lobby. Alright, I'll do 20 jumping jacks. 2, 3, 4, 5, 6, 7, 8, 9, 10. 17, 18, 19, 20. We get to hear it too. Alright, let's see. What do I do now? Leave my ham command alone, Mikes, please. This is dead history. This is a hazard? I'll be fine, Moising. Never forget. Alright. If I lose here, I don't know. We'll figure it out. Oh, this is a fun build. Oh yeah, things are so different now because this uses the same ammo type. I can't really hear anything, so I don't know where you are. Oh, I don't know who did that, but thank you. Much appreciated. I don't know if it was a subscribe or a follow, but thank you. Well, oh, that's unfortunate. I got double hit. Thank you for the follow, Grims. Alright, let me try hosting another one. That was weird. Why did the other one not host? Every time this is lame. Yeah, I don't like it either, Mikes. I also don't like that it takes 8 seconds to get into the game. Respawning is worse, it takes longer. Alright, what's it gonna be, Mikes? Stage? I'm at my exercise. Oh, that's heavy. Five burpees is crazy. I don't even have the space to do a burpee. Take off the headset. Will this hang if I do a burpee? Hold up. Let me test one. You can hear everything anyways. Can I do a burpee like this? Oh, I'll hit the headset. No, I have to take it off. I'm gonna do a proper burpee. You want in on the ones? What's your rager? What exercise are you willing to gamble? Because one of you is gonna have to do it if you lose. But yes, I'll let you in. Don't worry, the exercise is a joke. I'm not gonna mandate that. This isn't the army. Push-ups. Push-ups are my favorite. Make me do 20 squats, huh? 10 or 20? It's true. You said stage, right? I do love stage. I have no idea who followed. Is there a way I can check, actually, who followed? I'm not sure. Twitch dashboard. I'll look later. Ouch. Foggers. Oh, thank you. Oh, I got it. Let's go. Oh, that was fun. All right. What's your friend code, guy? Mike's, you gotta do 20 squats. That's crazy. Don't worry, Grims. Guy is an endearing term, I promise. Come on, Mike's, put those long legs to use. This is your exercise. What's wrong with guying people, guy? They used to say that to me all the time. They're like, "Guy, what are you doing?" And I'm just existing. I'm just being my own person. They say, "Guy." Like, I'll ask him a question. He's like, "Why are you talking to me, guy?" I hate guy. It's weird. I don't like guy. Don't call me guy. Mikes, please. Shush. You're done? We're waiting for the other dude to get in. Actually, while I'm waiting, we'll start another round. We'll be efficient. Oh, wait. Never mind. Oops. Hold on, let me add this code in here. Let's break the tie. Okay. Alright, this will be 6E 3C9 C25 92 647D. Oops. Okay, I did it wrong. 9E 6E 3C 9C 259 264D. This is not working. What am I doing wrong? There's gotta be a better way to do this. It's 70? Oh. There we go. Alright, we'll break the time, Mikes. Where do you wanna go? Actually, you know what? I'll pick this time. Let's go to... God, Welcome Center is such a weird stage to do it on. I don't think I want to do it there. I miss Scrapyards as a map, honestly. I don't know the Welcome Center boundaries. I don't either. I'll have to get back into the game and relook at it. I'll do a speed of like area left of pyramid. I never really figured out what the appropriate boundary for it is though. Like that's my favorite place. I forget what the area is. Is it like we're just gonna include the area around the streets, right? Like don't leave the outermost streets. And the building to the red building to the top right, I think is not included. But otherwise it's like a rough square like this, I think. I don't have it right now. I'll find it when you guys are playing. I'll find it. For now, let's ask F8. F8. What happened to Control C and Control V? Oh, I forgot about that. That's what happened. I also forgot that mountain is a boundary. Grims, I will let you in after this. You will fight. The winner decides if they'll play or not. Is what I'll do. Or if you have a if you have a request on who you want to fight, I'll let you do that too. Otherwise, I'll leave it to the winner. Also, Mikes, I think actually technically you're ahead because I won the warm-up round. So that's a different category. Let me wait for you. Oh. What the? It didn't fire. That sucks. Oh, nice shot. That hurt. Ouch. I thought you went higher for a little longer. Alright. Let me add someone to the party, and I need to look for... I assume this is you. Invite to the party. Oh, you're still in your prime. That's fine. Let me look for the document. No, what happened was I meant to pull out the AK. But my mouse buttons are... So I'm getting used to the new mouse. And sometimes I push the wrong button because I was using the G502 before, and it has the buttons up and down. This one has it side to side, which I thought was the original arrangement I wanted. But then after getting used to G502, I don't like it anymore. Do not worry, Mikes. I was not intentionally throwing. 20 squats? Alright. Is this other player inside? Okay. Um, yeah, but no, I messed up on the AK. I was sad because I needed that. You want to watch mics? Okay. How do I forget how to do that. I think it's... Yeah. "20 squats, I got it. I have to get this set first. Oh, alright. Let's see. Let's do my 20 squats. Let's have good form. It's like an ultrasound. Uh... 20 sumo squats. I'm gonna have to look up how to do that. Showed you the light. I learned push-ups, mics. Let's go ahead and start. Alright, let's see what this looks like. Excellent, I get 5% more speed. My poor armor. Oh, nice shot. Let me get another going. Weird. Oh yeah, they're still in there. I can't start until everyone is here. So what'll be the selection, or should I learn how to do sumo squats real fast? Whoops. Why can't I... Oh yeah, we're not in a squad. Ten, huh? Alright. Mike's is always first because he is closest to the server. I don't think... Can I do this? No, I have to take this off or else I'll hit the... Alright. Let's see. What else do I do now? My fingers are coming back to me. I'm starting to remember how to do this fast. Some random bug on my screen. Did I type wrong again? No, I didn't. Okay, this is not super gonna work. Melee, you feel so good to use again. I don't even want to use a weapon anymore, I just want to fight. Oh yeah, there is a bug here. I don't have a net, so I can't capture it. Ah, here we are. Catch them and release. Alright. So we'll just do this as a best of 5. So that's 1 each right now. Let me make sure Mike's is still... He's always the first one, so... Push-up gaming. Let's go. Me? What do you mean me? I didn't lose. I already did my 10 push-ups. I did the 10 push-ups. Oh my god. I did the 10 push-ups. I wasn't there. Oh my god. Alright, fine. Now I have to do 10 push-ups. I got you. Hold on. Let me do the push-ups first. So you guys don't complain. And I have to keep moving my chair. Actually, maybe I can get a good angle here. Alright. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then one more because I can't count. It's counting mics. Push-ups are a violent exercise. They rip your muscles. Also, I just realized that this might become necessary. Hold on. Is that my arms always hurt after doing push-ups? Yes. The paint overlay is important. Hold on. Is there a way I can adjust this? Make it smaller. Whoops, I adjusted the wrong thing. I need to go to the paint overlay. Whoa, that did not shrink in the way that I wanted it to. Well, that's unfortunate. That did not go about as I was expecting at all. It's too small. Never mind. I was going to put a counter up for what I've been doing. But, I can't figure out how to make the proportions appropriate. Get a spreadsheet of exercise going. This is true. I could do that. But I still couldn't fit it on the stream. It doesn't matter what format I use. Because I can't keep it on the screen. Use a text overlay on OBS. I'll look at it later. Oh, it is getting late. I should stop soon. Alright, alright, alright. We'll wait. Man, I have the game still turned down. And I think it was good on my other ear. I don't know. I have to use my old headset to figure it out. Let's see what happens if I do this. I was so late on the draw there. Oh, he got hit. That's good to know.
Evil. It was kind of funny. Yeah, we got 2-1 right now. I'm up ahead. Melee is so fun. Oh my god. What a good weapon. How can people say this is a bad weapon? I don't understand. I gotta get my Carl coins first. I was gonna say, what nerf are you talking about, Moising? And then I realized that you're talking about the melee animation nerf that occurred. You're right. They did try to counter buff it by giving you that slight speed boost, which really doesn't matter at all, but it still isn't any good. Also, I miss... They got rid of the freaking animation glitches. There's just a lot that, like... There's a lot that they got rid of that just makes me not want to play. Like, what was the harm in keeping the banana glitch, where, like, when you taunted and you slipped, your animation got all weird? That was fun. Or what about when you died and taunted at the same time? That was fun. They do hate us. I actively avoided reporting glitches for this very reason. But they did not care. Oops, that was a typo. I do too. Alright, there you go. Ravenous. Oh, the melee weapon. And it's not evil, it's the melee weapon. Alright, Mikes, you've sat out long enough. How am I evil? I'm playing the video game. It's not the weapon, but the method. What do you mean? That's a standard strategy. I didn't do anything different than what I, like... It's like the optimal way to do it. I don't understand. Let's see. Oh, wait, we're not in the... It's just funny. I just feel bad because I'm so bad at it now. My play is not there. Alright, Mikes, I won. So it's my decision, and I choose to tag out. So that means you guys have to pick the map. I definitely go for melee more than a normal weapon kill. Have you seen the way I shoot, Mikes? That's not BM. That's me trying to win the game. I know. So Mike's doing this match. Saw HQ. Okay. Alright, here we go. Who's gonna be doing some push-ups? We'll see. It can't be me, I'm already dead. Whoops. I probably should turn up my sound effects for other people. I don't really use sound effects, but... I don't like push-ups. I'm sorry, Mikes. It's not fair. Just because you're a main dwarf doesn't mean you get to do the exercises you're the best at. It's not fair to us short people. Push-ups are more my style because I'm like 50 pounds. Alright. I'll let you in, Softy. Do you want in after this, immediately after? Oh. Jeez, that's really loud. Okay. Alright. Armorless. How much ammo does Mike's have? He's got enough to go in, and he's got a blue revolver. Purple silent pistol's not bad, though. Mike's is trailing behind, switches to a hunting rifle. Alright, they're both really far out. The gas still has a little while before it comes in. And this is a big map, so it's going to take forever for gas to be a problem. Alright, another fight. I don't understand the strategy with the bananas, except for putting one here to possibly be a problem later. Alright, good armor swap. More bananas is a bad idea, especially in his position. It's a double... Okay, Mike's is dead. Yeah, there's just nothing he can do. He took too long playing with bananas. Well done. I know, Mike's. And you call me evil. Oh, whoops. Is it gonna let me in? See, what happened to this? Why couldn't we have this? This is better. We don't need to have like some dancing animation or whatever the heck it is. I assume this is why it takes you guys so long to get out then? Is you're stuck there? Or I don't know. I don't remember how that goes. How do I invite sobbing? Rice, you have to get online. Oh, that did not take long at all. I am. Okay, what are you guys feeling? Are we doing 2v2s? Or are we still sticking to ones? And we'll just rotate out more frequently. Mike's does 10 push-ups. Either or. Sabi, what do you want to do? I already invited you. Being made to do push-ups is awful. Hello. I'm sorry, Mikes. It had to be done. What's going on, Alexander? This issue with my knee is so weird. Because normally it's like, I'm pretty sure it's on the other side. I can't remember where that knee pain was, which you think I would, because I've had it. It might actually be the same spot now I'm thinking about it. That's crazy. The game takes so long to transfer people now. The problem isn't even like the new freaking matchmaking. I mean, it's annoying, but the problem is that it's that like if things like that happen, it just takes so long. It should not take 8 seconds for the game to go when it used to take 3 before. It's ridiculous. I'm just gonna stand over here and away from that. I'm sure you'll be fine, Softy. Oh. Are we supposed to be... Did we want to change it? What do you want to do, Grims? Are we sticking with it, or are we switching? I'm the host. I don't even have some clumsy. Let's just, like, start over. We'll do ones, or, you know, we'll do twos. Let me fix it. That way we can all play. Everyone playing is fine. I'm not... This is annoying. I keep thinking that I'm in the game immediately and can just start putting commands out, and you just can't, because I have to wait forever for the game to matchmake us into an empty lobby, and then do this little thing. Some quick twos and then ones. I can recognize the feeling of that feeling in there. Oh. Yeah, that's right. I forgot how ones works. I think what it does is it matches us by, oh, no, that's not the case, because Sobbing got in first. Sobbing got in first, and then you got in second, Mikes, so that's not how that works. I don't know if it's randomized. Yes, you can't, you've always been able to do private matches. She's not on your team? Oh, that might be why. Okay, let's fix this. Also, that's a he, by the way. You're fine. Look who dragged in the Emerald bird. Irma Bud. Are we all properly filled now? I don't even know how to turn on fill. Where do you even do that? I can't play this video game anymore. I just don't know how this works. Okay, I think I have this set up properly. If not, then I'll just go back to solo and I'll bow out. It's in the bottom right? Okay. Sobbing, I know it's you that's not ready. That's okay. I clicked it. You think I have to do it? I already have it on, so I had mine off actually, and it still put me on your team, Mikes. I don't quite understand why, because we're all in a party, so we should all be getting paired up. It doesn't really make sense. But if this doesn't work, what I will do is I'll just put us in solos, and we'll just play with Team Attack on. I'm perfectly fine with that. I think that's more fun, actually. Anyhow, how is it doing, how's it doing, Irmabud? How are you? And hello, Alexander. How is everyone doing on this nice little night? We're all here. I have no idea. But do we all have fill on? Do you have your fill on? Softy? He has a better melee than me, Mikes. I'm very sad. Again, Softy. Oh yeah, you don't. Also, why didn't it work? What was the code? I wasn't paying attention. .507 POC. Okay. You go to... Jeez, I don't remember. Hold on, let me do this first. It's 11:24. At least nothing bad is happening. Alright, are we all properly settled? You guys are still not together? Okay. Yeah, that's the solution. It's easier to just go solos and just play with Team Attack on. I wanted to keep it off for reasons, but it's okay. I bet you the code's still not gonna work. I'm gonna have to reset it. Oh, wow. I don't know. Probably what you need to do is you probably need to invite each other to a party and then join together as a duo, and then maybe it would work. It's possible that what's happening is because I invited Mikes to my game first, it assigned us as a duo, and then because I assigned you two, but you guys weren't in the same party, like you're just like unassigned, and for some reason it just doesn't fill. Or maybe it's it will fill if you guys put it on. It explained why Mikes would have it not work even though his is, or it'd have it work even though it's off. We need to go someplace big, so let's go... I can't type. Okay. If you are talking about lag, yes. I think we all have it. Even Mike's has it. Mike's is a better player than I am, Softy. You've always had it, Mike's. You were just in denial. Oh, this will be fun. Ah, I was so close. Oh, whoops. Oh, no. Oh, this game is great. Disgusting, I'll do it again. I was trying for a while to like do that intentionally. It's so hard to do and not die though. Oh my god, that was so funny. Doing that in 1v1s intentionally is like the most fun thing. That time was not intentional, but I saw my opportunity when I wasn't immediately pursued. Must have been the wind, huh? That shouldn't be too hard. Let's see. Can I add 2 wheels? Add a wheel. Okay, there we go. Of all team combos and put it on a wheel. Let me see here. I think what I could do, actually... Wouldn't this work just as well to, what is it? Use something like this, right? Could I do something like this and just make it something like... Oh, no, it won't, because I need to have... I need to do it differently, right? Yeah, you're right. I have to just add a whole bunch of wheels and just do it. Okay. Why am I getting an ad in the corner of my thing? My ad block is not working. This is right, right? You put some of them twice, Mikes. Yeah, some of them were put down twice. Isn't this right? Look at the stream. Isn't this correct? Alright. Okay. Sure. Can't you just do slash roll for a few times? Oh yeah, that would be smarter, wouldn't it? Well, it's okay. The wheel's more fun. Mike's is a very consistent roller. How do I spell palace? Oh, I didn't even realize. I was trying to go opposite of where the plane was going. Did you want to throw at biased odds, Mikes? I can do that. Also, I have not done any exercise in a while. Some things might need to change. I agree, Mikes. You were dumb? It's hard. It's a good thing I verified. This map is massive. I keep getting so close to shooting mics. I'm sorry. Well, there you go. I think I'll do 2 more. Alright, while I'm waiting for you guys to load in, let's spin the wheel again. Yeah, it is. It's really scary. Okay, Mikes and Grims, huh? Alright, that means that, I'll be with Softy. I also have to... No, I refilled my water, so I can just do this. Thank you, Super Bears. I might have to make a new rule to the exercise rule and make it every time anything happens, I exercise. You want to try with hamster balls? That is cursed. Alright, I'll turn it back on, but if you get ran over, it's 30 push-ups. I joke. I'm not gonna make people do 30. I'll do 30 if I get ran over. Go for your 10. You're not even doing them? It's okay. If I lose, I will do them. Do keep in mind, hamster balls are probably not going to spawn inside of here. Also, oh, thank you. I forgot about that. I need, like, there's probably a way to turn on a screen transition, isn't there? Remember, Sobbing, you're my team. that worked out a lot better than it should have. Softy, please. Oh, I couldn't get away from it. Softy, be careful. Okay, I think you see the banana. That's good. No. Oh, you're shot. Yeah, I saw it coming. Well, that's how that goes. Let's see. I'll do... This will either be the last one, or the next one will be the last one. Like, 1 or 2 more is what I'm saying. Depends on how long this takes. Let's bring this back up. And rerun it. Alright. It's duos, so you each get to choose what I get to do. Wait, what the heck? Why is this removing my results? How do I not make it do that? No one told me that was happening. I broke it. Oh, this is for waiting. That is... Yeah, let me get that. I guess I just have to reset it every time. That's a little annoying, but that's okay. No, I want it to be fair, sobbing. And it was me and Grim was the result, so... Let me make sure I have this up right, yeah. No, there should be 6 results. Hold up, I'm gonna fix this. Why does the wheel keep doing that? That's so weird. I don't like that at all. Alright. I am going to do 20 push-ups now. Or I'm gonna start this first. 737. I think that's the right code. Scroll down on the page. I don't see that option here, but let me turn this off. Oh. Oops. Let me do my 20. Alright, 20 complete. Let's go for it. You'll be fine, Softy. You'll probably kill me. Alright, let me not shoot the player that I've been fighting non-stop. Ouch. That was a lot dirtier than I would have liked it to have been, but it at least got done. Where did he go? Let me know if you want me to ghost you, Mikes. I should be doing that by default, actually. The melee is a tool, not a toy. I saw you using that as a toy, Grims. That's not how you use it. It's a tool, not a toy. Yes, I know, Mike. At least it got done. That was a really fast game, though. Wasn't ready for the aggro. Yeah, I've always been a bit more aggressive in 1v1s. Because I'm scared of fighting. So I need to end the game quick. Oh yeah, I have to pick the teams, don't I? Hello, Super Bears. You're still with us, I see. Okay, now I am with Softy. You're my teammate now, Softy. Yeah? Oh, is that what I'm doing? Okay, we know that we know what the teams are, but I see. Thank you, Mikes. Now I understand. Resort is too small for 2v2, unfortunately. is barely big enough for one person. I guess we take bottom right then. I think. I'm not really familiar with HQ. Top left, bottom right. Okay. You're enjoying SAR, Super Bears? I'm glad. Oh, wait. No one told me to turn the wheel off. Oops, 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 oops. Let me do that. Also, I accidentally adjusted my sensitivity. No, stop, please. There we go. Yeah, I thought maybe I'd be out of range of that, but no. Not out of range. Just can't do that. To be fair, I shouldn't have done that in the first place. Because even in like a regular scenario, that's still too close. But I just felt like maybe I could do that. Just being lazy with moving around barrels. I shouldn't have done that. Softy, pick up a gun. And such it goes. Yes, I ran in front of a barrel, and unfortunately barrels are even more of an instant kill. Like, barrels are even more devastating than they used to be. The other sad thing too, actually, I just realized this. The other sad thing is that now, because of the way barrels work, I can't do my melee thing. If you remember, I used to walk up to a barrel when someone was coming close, like a handle or something, and hit the barrel, and then kill them that way. That's not possible anymore, because I also get slipped by the barrel. The most I can do is take my armor off, and then hit the barrel, and put it back on after I get back up and try to take advantage. That's really sad. They really do keep nerfing the melee. It's actually insane. The devs might actually think it's overpowered. Yes, Emerabud. Oh wait, whoops, I forgot I got it. Alright, let's spin the wheel, and while it is spinning, I will do... What exercise do I do, Mikes? Wasn't the last one supposed to be last? I don't know. I have to look up how to do a sumo squat now. Oh, you just have a wide stance? Okay, I think I get the idea. Let me know what we decide on for map while I do my 15 single squats. I hope I'm doing this right. I'll grab my helmet. Oh man. Port is an awful map. Mike's, why would you do this? Oh. 15, but I've never done them before, so I'm a little slow. Alright. Lavs will work. Alright, I'm pretty sure I'm on his team, right? No, it's you two. I'm with Rice. I'm pretty sure. What was the result? Yeah, you're I'm with Rice. Yes, Irma. No armor. All Mike's understands is the top. Okay. Oh, where is Softy? Not the position I want to be in. I gotta go. Hopefully I can put this to some use. There we go. He overextended a bit. Mikes, you're making this really hard. Come on now. Let's not do this. Actually, this is a better weapon to have. No! My weapon didn't pull out! Ah, that's frustrating. Yeah, and he had Vile. There was no way I could do it. If my weapon freaking pulled out, these mouse buttons are irritating me a little bit. That's not how I would like that to end. I was fine with losing, but not to that. Yeah, I forget. Old and wise. No, I should stop. I want to keep going, but I should stop. I don't think I'll play more tomorrow. 1v1, like, playing SAR is harder. One more? Okay, fine. Sure. But I have to go after this, I really do. No time. Oh, look, another rematch. Well, you get to pick another exercise, Mikes. Or you guys can split the bounty and make me do 2. Let's see. I know, that's why I need to go. It's late. Too late now. We gotta play. One more moising. Yeah, so as I was saying, because I'm gonna talk anyway, so I may as well just do that while we're playing the game. We're going to go to Mountain to end. Not Banana Cave, not Banana Shrine. So yeah, it's hard for me to get 1v1 set up because I'm going to be moving into a new place after this. Moving pretty soon, so it's going to be a bit rough for playing, but I'll see what I can do. SAR is kind of fun. What, like tomorrow? Tomorrow's probably a good time. Yeah, probably maybe a little bit later in the day. So I do have to do things. Playing like Gloomy, just shooting at everything. Please don't shoot. Oh, ouch. Surely there's something I can use. I don't want to have to tape. Oh, luck is on our side, huh? Well. Look at that, Sabi. You were the MVP here. Yeah, that was a rough situation. Okay, Mikes, you did not give me an exercise to do. So we will do this together. We are going to do a 90-second... I told Sobbing to. Mikes, no. We're going to do... He gave it to you? That's crazy. I thought you weren't going to exercise Sobbing. Okay, then if you're going to do it with me, 2-minute plank. That's what we're going to do. I'm not doing it with you. You get to choose what I do. I don't get a choice here? That's crazy. No one wants to plank. That's insane. Fine. What am I doing? Mike's has to do it too, though, because he lost. If I had more space, I would choose the high crawl. What do you mean you need to see what they're called? Hold on, I need some fitness music. There we go. Elbow to knee crunches? I think I need to look at that and see what you're talking about. Oh, you're talking about the supine bicycle. That sucks. This is what it is, by the way. The supine bicycle. That's a lot to do. 30 for each? That freaking sucks. No, it's fine. I'll do 30. Unless if Mike's wants to participate, then I'll do 20. What's one? It's both knees. So one up and then one down. So it goes 1, 2, 3, 1. You can't see me? What do you mean you can't see me? He's cooking? How do you know he's cooking? Mike's always tells me when he's cooking. He's not cooking. Alright. I'm tired of waiting for you all, so I'm gonna do it. Alright. Let's get it going. Okay. Steel cutouts are good. Alright, I can't see chat anymore, so you have to use the Twitch chat if you want me to see. Geez, these headphones are large. I don't know if it'll... Actually, I probably... No, I'm gonna take them off. Actually, I can probably wear them like... Yeah, I can wear them like this. It'll be fine. Let me just lift this up. Alright. One. Nah, I gotta take this off. It's too in the way. Let's start over. Two. Three. Oh. Oh, 20, 2, 21, 2, 2, 2, 2, 3, 2, 4, oh, 2, 5, 2, 2, 6, 2, 2, 8, 2, 2, 9, let me catch up a little bit. Oh, okay. You already did core mics. Do you have the 8-pack that tall people get? Eight-pack. I'm sure it's somewhere. Oh, that hurt. Well, that finally got me to break a sweat. Be quiet. I'm alright. You know what? There. A lot of water. Oh, ow! Alright. You were being mean to me, Softy. I don't. I'm just a little guy. What are you gonna do about it, Mike's? Fine, I'll add you back. I'm not even playing. Alright, let me drink. There we go. Alright. Thank you all for, jeez, that's cold. Thank you all. I haven't had cold water in so long. The redemption is an hour long, Mike, so I'm safe. Thank you all for joining. It was fun. I refunded your points. That's all you're getting. We'll talk about this later. Look, it's midnight. I have things to do. I just did crunches. Oh my god. Okay, let me see if I can find the freaking thing. I know I refunded those points, but you know what? Just to get you off my back, I'll refund them again. Your rewards, channel points. Thank you all for coming through to play. I mean, like I said, stream really picked up after I stopped my study stream. The mistake was not studying the incident command system, like Mike said. Oh yeah, I gotta end fast. It's a rookie mistake. But anyway, where the heck do the viewer rewards? I actually have proof that I refunded them, Sabi. You don't have any requests in the past year. No, you have one request in the past year. It was free? Okay. I'll refund it. Because I'm out of water, and I really gotta go. I can give you a free water later, but for now, just take your points. I do have to go, though, because important things are starting to happen now. So thank you all for joining. I'm going to find someone to raid really fast. I don't even know if I have time for that. I might. It depends on what they're doing. Let's raid... We're raiding Irmabird. Emerabud. Absolutely. Thank you all for coming through. Like I said, I'm going to try and do more streams. My situation might come to a standstill soon because I have personal things going on right now. So I'm definitely going to be busy, you know, for the coming time. But we'll see what I can do regarding streaming, but it may not be any, like, higher 8 p.m., more free-moving games like SAR for a little bit until I get set up. But, sorry, Irma, you're selected. You know, thanks you all for coming through. It's nice to see you. I know I vanish. I'm just weird like that. If you want to hear a story, you can message me on Discord or Steam or whatever. You'll see me again. It's fine. See y'all later. Oh, shaking my tail.